It feels strange actually to have people. So it feels kind of strange to have people in the chamber, which is strange in a good way. Well, good afternoon, everyone. I would like to call this meeting to order, and at this time, I would like to acknowledge that we meet on the traditional land of Treaty 6 territory and acknowledge the diverse indigenous peoples whose ancestors' footsteps have marked this territory for centuries, such as Cree, Dene, Saulteaux, Blackfoot, Nakota Sioux, as well as Métis and Inuit, and now settlers from around the world. I will do a quick roll call. I will start with Councillor Wright.
I'm here.
Councillor Knack.
Good afternoon and happy birthday.
Oh, thank you. Thank you so much.
You met Councillor Stevenson.
And, you met Councillor, oh, okay. I
Both of you.
I won't
Both.
thank you then. Okay. Thank you, Councillor Knack. And thank you on behalf of myself and Councillor Stevenson. Councillor Principe.
Good afternoon.
Councillor Stevenson.
Good afternoon.
Councillor Paquette.
Good afternoon.
Councillor Tang.
Good afternoon.
Councillor Hamilton.
Good afternoon.
Councillor Rutherford.
Good afternoon.
Councillor Salvador.
Good afternoon.
Councillor Cartmel.
Good afternoon.
Councillor Rice.
Good afternoon.
And Councillor Jans.
Good afternoon.
Adoption of the agenda.
I'll move the adoption of the March 8th special City Council meeting agenda with the addition of item 4.1, Bylaw 20061, the temporary mandatory face covering bylaw amendment number 7.
Second.
Thank you, Councillor Rice. The 4.1 is the addition. Any questions on the approval
Yes,
of
sorry,
the
I have a
agenda?
quick question, Mr. Mayor.
Yeah, go ahead, Councillor Knack.
Sorry, I just couldn't click on. I was just trying to get a sense of knowing, and I think we saw the news that as of 11, there's a press availability at 4 p.m. from the province about this issue. And I'm just wondering if we have any knowledge about the specifics of that, because I'd hate for us to spend 2.5 or 3.5 hours discussing an item only to, at 4 o'clock, not have any need to. So I'm just wondering, do we know that information?
We don't, I have some information that is intergovernmental, but I don't think we have any legal, official information at all. So
Mr.
maybe
Mayor,
I'll
we
go
haven't-
to our legal counsel for something.
We haven't seen the bill yet, so we've got teams monitoring in the background,
Yeah.
and we'll let you know as soon as we see anything.
Okay. Yeah, I guess my question was whether, without that knowledge, how well and how effective can we be for the first 2.5 hours of this meeting without that knowledge? And so I do see Dr. Sikora here, and so maybe we can spend the first bit of our time asking him questions and hopefully get that knowledge partway through the meeting. So, okay, thank you, Mr. Mayor.
If there's a will on council, maybe I can quickly go intergovernmental update in private to give you a sense, right? If that is the desire of council, we can talk about that after maybe approval of the agenda.
Well, in which case, just with my remaining time, should we add an item to this agenda for an intergovernmental update so that you can share that knowledge? So can I make
think
that amendment?
well, that will be beneficial if we could 5.1.
So I'll make that amendment to add that
So
to
just
the
for,
agenda.
just for clarification, Councillor Knack, this is a special council meeting and the purpose of the meeting has already been stated. So the only items that can be added are those that are germane to the purpose that the mayor called the meeting for. If under the verbal update, council does need to go in camera to get some additional information, you can do so
Okay.
subject to FOIP. You don't need to add an
Perfect.
additional
Then
item.
no motion needed. Thank you, Mr. Mayor.
Okay, Councillor Jans.
Thank you. I was just wondering about the purpose of the meeting was to receive an update on the temporary face coverings update. The purpose, wouldn't adding a bylaw or changing a bylaw or something, wouldn't that require a notice of motion?
It requires the supermajority approval. That's my understanding, right, Madam Clerk?
Yep, so to add the bylaw to today's meeting will require 9 of the 13 of you
Yeah.
to agree to add the bylaw to the agenda.
Yeah, not a special notice.
Okay, because I thought today would be the discussion about the bylaw, and if then somebody wanted to move a change or a repeal or an addition to the bylaw, that would have to be moved as a notice of motion for a subsequent meeting.
No, that's not my understanding of the process. My process is that if we want to discuss the bylaw today, it can be added to the agenda, and can be added to the agenda at the approval of at least 9 members, right? Madam Clerk?
So the information that we had when the meeting was called was for the purpose of discussing the mask mandate. The
Yeah.
agenda, again, this was all quite last minute, so the information that we had when we released the agenda was the verbal update. There is also a repealing bylaw that has been presented, and it's up to council today if you want to add that to your agenda. If you do, it will require 9 of the 13 of you
Yeah.
to add it to your agenda
Yeah.
for discussion.
Yeah.
So I guess I'm okay with the verbal update. I'm not sure, I would rather see somebody move the bylaw change. And so if we can, I don't know, I guess, does that mean I have to vote against the approval of the agenda?
If you don't agree with adding the bylaw to the agenda, then you would definitely have the right to vote against it.
Okay, so we can have a verbal update, we can have the conversation, and then if somebody feels inclined, they can move a notice of motion and we can decide whether to.
I don't think notice of motion is required. But if we want to add the bylaw to the agenda, we need about 9 votes in order to do that.
Okay, I'm
Okay. Councillor
a
Steve?
little, I'm still a little confused. I'm sorry, Mr. Mayor, I'm not trying to be
No, I know.
pedantic. I'm,
So Madam Clerk, can you explain it again?
Yeah, absolutely. So the purpose of the meeting was to get an update and to have a discussion on the mask mandate. What was presented from administration is a verbal update. If council wants more than that and they want to actually to add the bylaw to your agenda today, that is up to council. The reason you don't need to do a notice without motion is the entire purpose of today is to have this discussion.
Yeah.
It's a special meeting, so there are special provisions that are provided.
Yeah.
Again, the meeting was called, there wasn't a lot of notice. We met the notice requirements, but we didn't actually know what administration was going to be bringing forward, so here we are today. You already have one item on your agenda, which is a verbal update. A councillor has moved to add an additional item, which is relevant, which
Right,
is germane
which is
to the
relevant
purpose of
to
the
the,
meeting being called, and that decision is before the assembly. But just a friendly reminder, if the motion fails, we're going to find ourselves in a bit of a situation.
Okay.
okay, thank you.
Thank you, Councillor Jans. Councillor Stevenson?
So just to clarify, by adding this bylaw to the agenda, the bylaw can pass or fail. We're not approving the bylaw, we're just agreeing to talk about the bylaw.
So at this time, adding to the agenda would mean that we will have a discussion on the bylaw. And if, in order for it to be repealed or upheld, there'll be a separate vote, right?
Apologies. So the first step is, do you want to add that to your agenda?
Yeah.
You don't have to add it now. You can add it later on in the meeting if you so wish. If council wants to make a decision regarding the mask bylaw, for example, repealing it or changing something in it, all bylaws are amended by bylaw, and that would require first, second, consideration of third and third reading in one particular meeting. So its normal provisions apply. Again, this is a special council meeting for the purposes of discussing the mask mandate, and it's up to council about how many items and discussion points they want to have related to that topic.
Okay. Is that clear, Councillor?
I think so, and just for understanding, item 4.1, this is an addition brought forward by administration?
No, this is the addition that we as a council are adding to the agenda so we can talk about the bylaw, which is germane to the overall discussion, because the whole purpose is about talking about the mask bylaw.
Oh, I apologize. So bylaw amendment number 7, that is the current bylaw that we have in place. It's not a proposed amendment.
No, 4.1 will be talking about the current bylaw.
It is
Bring-
the current bylaw.
yeah.
So
And
this
we're
is
just
where
bringing-
this gets tricky because you don't actually have it in front of you. So this is just one of those situations where the agenda was provided to council at 10 o'clock this morning. It hasn't actually been approved by council yet. A councillor has made an amendment to the motion to approve the agenda because they want to bring forward, it is a repealing bylaw. Just for absolute clarity, what we could do is we could provide a copy of that bylaw to you so that you can have a decision or a discussion about whether or not you want to add it to your agenda. We're happy to support council as it wants to move forward, but right now what you have before you is a motion to approve the agenda with one change, which is to add the repealing bylaw.
Okay, so it's
So
the
for
repeal.
clarification, what you have, that.
Can you
the
speak
amendment
up,
number
Michelle?
7 The amendment number 7 is the repeal bylaw. It's not the current bylaw.
Okay.
It's a bylaw to repeal the current bylaw.
And then we can vote on it whether we want to repeal it or not.
Sorry, Mr. Mayor?
So it's a repealing bylaw, but council would have to vote whether to repeal or not to repeal.
If you pass the bylaw,
Yeah,
that you would be repealing the current temporary face
but
covering
we would have to vote to repeal.
Correct.
Yes, but at this
Absolutely.
time, all we're doing is adding to the agenda,
Correct.
right? And when we come to that item, at that time, we will have a discussion, then we can either repeal it or not repeal it.
Yeah, and I think, Mr. Mayor, subject to Madam Clerk, the process would be if council adds this item, that bylaw to the agenda, you may wish to break to get a copy of that bylaw, to
Okay.
review it, to be prepared for the conversation.
And you can provide that copy as we have questions to administration along the way, right? It's not, we have copies there now, so that can be provided. Okay.
And just for clarity, by not having the bylaw as it currently stands on the agenda, are we not able to make any changes to, so I'm assuming it's bylaw amendment number 6? Like if we wanted to take the existing bylaw and make some changes to that, would we also have to bring it forward onto the agenda? Yes, okay. But we could do that at a later.
Yes, you would. Any changes you want to make to the bylaw would need to be added to the agenda, and then depending on what that would, we may or may not be able to amend it on the fly, or we would need to create another amending bylaw, but without knowing what that is, it would be difficult for us to give that advice.
Okay, and that can be brought forward at a later point in the meeting today?
Depending on where we're at and at what decision point, sure.
Okay. Okay, thank you. Thanks for the clarifications.
Thank you. Councilor Salvador?
Thank you, Mr. Mayor. So I think that provided some clarity. So as it stands right now, bringing this forward would just trigger a conversation. And of course, there would be a vote around actually repealing. So that makes sense to me. I'm also wondering, just given the timing of this meeting, going back to Councillor Knack's question, I'm just going to put it out there. I do wonder if there's value in postponing until after we have heard from the province at 4. So I just putting it out there for discussion, I guess. That's something that is in the back of my mind as well. Would be curious to hear your thoughts, maybe Mayor Sohi.
I don't know what they're going to table, as our legal counsel doesn't know what they're going to table, but I do have some information that I would share with you, but that would have to be going to private, which is related to this item. So it doesn't have to be intergovernmental, but I can do that as we get into the proceedings of the
So
meeting.
someone could just make a motion to go in private once we use that? Okay.
Once we're in the meeting, yeah.
Alrighty, thank you.
Okay. Councilor Wright?
Thank you very much, and thank you for the clarity, Ms. Plouffe. That was my concern, that this wasn't the current bylaw. But if I am to vote in favor of adopting the agenda, I would prefer not to have it with the addition and to have the motion introduced later. And that is possible, right? That who's ever brought forward this motion can then put it forward later in the agenda?
Yes, that is correct.
Okay. Okay.
Okay, thank you.
Councilor Rice?
On the top of other comments my colleague Councillor mentioned, this additional item is actually a surprise, and I believe for
many of us and also for the public. So before I drive to City Hall, I just checked and there is no one item on this. And then also given the factor of our meeting and then the heavy discussion will happen and for the original item and specific for this verbal reports and the discussion, I personally, I won't not support this additional vote adding to our agenda. Thank you.
Councillor Rutherford?
Thank you, Mr. Chair. I just want to speak to, I will be supporting this. I think that we, as council, owe the public our discussion on this, our debate on this, and our votes, and have our votes recorded one way or the other, whether we want to or want keep the bylaw or repeal it. And so I will be supporting this addition, and I do believe that this is exactly what the public is expecting for us to discuss today.
Okay. Thank you, Councillor Rutherford. And can you take the chair for a minute? Because I do want to quickly speak to this, just to reinforce that point.
So taken.
Yeah, what we are expected today is to make that decision, whether we keep it or repeal it. There will be a verbal update, absolutely, right? But if we want to give some sort of certainty to public what a decision we will make, then we would have to have that item on the agenda. And in order to have that item on the agenda, we need to have that 9 people approve it. If it doesn't get approved by 9 people, I just want to understand, Madam Clerk, if it's not, the vote is taken, it fails, right? Then it cannot be added back to the agenda later on, right?
Yep, that's correct. So
It can be or cannot be?
It cannot be. So
Okay.
what's on the floor right now is a motion to approve the agenda with an amendment.
Yeah.
And so if that fails, then you could then move a motion to adopt the agenda as presented.
Okay, got it. Then we cannot add it back. So I think we owe it to Edmontonians to make a decision either way, whether we keep it or we repeal it. And I will take the chair back.
There you go.
Councillor Wright.
Hi, before voting on it, can we see what the amendment says?
There's a copy that can be sent
Yeah,
out.
so we can, I would ask if we're going to pass out the bylaw, I would like to just take a pause, because if we're going to pass it out to council, I also want to make sure that the public is aware of it. It is a repealing bylaw, and perhaps Ms. Plouffe can explain that. It is basically a bylaw that repeals the existing temporary face covering bylaw.
That's correct, and it is a bylaw like every other bylaw. It needs 3 readings, and you will decide at each reading, and whether it even if you want to do the 3rd reading in the same meeting,
Yeah.
you need to vote on it.
So that needs to be made public before we accept the bylaw, Madam?
Yeah, is it possible maybe
We
just
take a 5-minute break?
Yeah, I can take a quick snapshot of it and I can put it in the chat, and then
Yeah.
we'll just get the clerk's team to put it up online.
Okay.
And that way everybody has access, including the media.
Yeah,
Thanks so
okay.
much.
Got it.
Thank
Thank you.
you.
We will recess for 5 minutes. we were on the adoption of the agenda. Okay, so Madam Clerk, the copy of the bylaw has been given to council members, and it has been posted on for public to view as well. So we are legally good? Sound, Madam?
So we haven't technically added it to the agenda yet, but we have provided paper copies. I provided a copy to the media that's here in the room, and I believe we also have a copy of what's being considered online.
Yeah.
Should this motion pass, we will officially add it to eScribe and update the website just as
Got
quickly as we can.
So at this, do people have concerns of adding this to the agenda? Councillor Stevenson?
Just procedurally, I think I was looking forward to having the conversation first before speaking or voting on any specific bylaws.
Yes, that's exactly what will happen. We will have a discussion on 3.1, right? Where we can ask all the questions that we want to ask. Then we'll go to 4.1 if it's added to the agenda.
Yeah, and maybe just a bit of greater clarity. So just looking through the report, so it does say it is recommended that council repeal the temporary mandatory face coverings bylaw effective immediately. So just to clarify, this is a report from administration with this recommendation?
It's an update, Councillor, it's a verbal update, not a report.
Okay, but the recommendation is
In
administration's.
4.1.
In 3.1?
The bylaw.
So Councillor, I do apologize. It's just our bylaw template form, and so we very rarely would bring forward anything for council's consideration that was not in the correct form. So unfortunately, we do make administration put something in that box. It's just a technicality.
So just in item 3.1, we would provide an update and it would provide our advice. That was the intention. And then from there would be a step related to actions in the bylaw. So this, as Ms. Giesbrecht has said, this is a standard form of what a bylaw would be in the form of based on how it's been brought forward by the councillor that put the addition of this item to the agenda.
And I guess maybe that's, I think just procedurally, I'm not very comfortable with how this is rolling out, because again, it seems that, again, I'm unclear if this motion, so, again, in a normal meeting, in the normal course of a meeting, we would have a conversation, a councillor would put a motion forward, someone would second that motion, and then we would vote on that. This, I'm unclear if it's procedural or if it is unintended outcome that councillor is moving now in advance of the conversations that we've had. I think that's my lack of comfort with this approach.
Is that a question to the mover?
Yes, Councillor Hamilton.
So it's not an attempt to sort of, I'll say it's not my explicit attempt to gear the conversation in a certain way. What my understanding is that we couldn't even have the conversation around amendment or repeal if the bylaw isn't on the table. So this is, I think, I would look at this as a placeholder so that if we wanted to have the conversation around action, there is a mechanism by which to do it. As I understand, in relation to the clerks, if we wanted, and I think Councillor Jans touched on this, if any action were to happen, an amendment or repeal other than the status quo, and that could include the masking bylaw going in a different direction, for instance, extending it or changing any parameters of the bylaw, we would have to either bring a notice of motion to a next council meeting so that the bylaw could be brought forward, or we'd have to call another special council meeting. If I understand that correctly. So this allows us to have the conversation that I think Edmontonians are expecting us to have today and give us the space to take a form of action, not precluding the discussion on what form of action we would like to take.
Yeah.
And just to clarify, again, one last time, if the conversation led to a direction to amend the existing bylaw, we would be able to bring that onto the agenda later in the meeting.
Really depends on what that is. We have
Right,
to have,
whether
I
it's on
can't
the
give
fly,
advice for
yeah.
something that I don't know what that would be, but at this point in time, the bylaw is not on the agenda.
Okay. Well, thank you, and thanks to the mover for that clarity. I look forward to hearing my colleagues' discussion.
Thank you, Councillor Stevenson. Councillor Rice?
Thank you, Ms. Mayor. I really want to say appreciate the clarification and study Kirk provided, and my colleagues, and also Mayor Sohi. And I do understand, and then so this bylaw has to be on our agenda, and for us to have this discussion moving forward. Otherwise, we couldn't have the outcome and as many Edmontonians expected for today. So right now, I just want to state that. Thank you.
Thank you, Councillor Rice. Councillor Paquette?
Yeah, Mr. Mayor, just for clarification for the public, for everyone who's here, what is on the floor here is just putting the bylaw onto the agenda so that we can actually talk about it. Voting to put this on the agenda is not voting on the bylaw. It's just voting to be able to talk about the bylaw. So let's have that super clear. It's my understanding that to get this on the agenda, we need a super majority of votes. So we need 2/3 of council to agree to this. However, once it is on the floor or on the agenda, and when we get to the point where we're talking about the bylaw, we don't require a supermajority anymore, and that's the time when we can either we can make decisions, we can do a subsequent. I mean, there's all sorts of manner. There's lots of conversation. This is not the vote on whether or not we rescind or repeal a bylaw. I just want that to be super clear.
Yeah.
Mr. Mayor.
Thank you, Councillor Paquette. Councillor Wright?
Hi, I just want to clarify procedurally, I guess, if the bylaw is added to the agenda, at any point, the councillor can call it to a vote without allowing for that discussion. Is that correct?
Not until we get to that point. So we will not be discussing 4.1. We will be discussing 3.1 first.
So we will still have the opportunity to ask questions
Of course.
Administration and Dr. Sikora.
Absolutely.
It won't limit our
No,
debate.
not at
Okay.
all. Not at all.
Okay. Thank you very much.
Thank you, Councillor Wright. All right, seeing no more questions on this, please, I will call to vote to approve the adoption of the agenda with amendments of addition of 4.1.
We have the votes.
Display the votes, please. That is added to the agenda. All right. Protocol items. Councillor Rice has a very lovely protocol item today. Councillor Rice, over to you.
Thank you, Ms. Mayor. Today is really special day, and then so we have our Councillor Annie Stevenson and the birthday, and with our International Women's Day, same day. And also we have our Mayor, Sohi, and birthdays, and then all the world celebrate both of you's birthdays. And when I was driving to City Hall, and I saw the sunny, all of a sudden sky, and it become from cloudy to sunny. I found it's very lovely and then special days. Let me take this moment and say good afternoon, everyone. Today is International Women's Day, so I wanted to take a few moments to acknowledge the importance of this day and what it really means to me. So we make this day for several reasons. It's a day that honors the social, culture, and political achievements of women, not only in our city, but around the world. It's also a day to reaffirm our city's commitment to achieving gender parity. So I just want to say, and then also we are stronger when women's voices are heard and respected. The City of Edmonton launched 2 initiatives to help close the gender parity gap. Number 1, a City Women's Initiative was started to ensure women's rights, issues, and opinions are represented fairly and equally and from every social and cultural background. Number 2, the city also established the Women's Advocacy Voice of Women, and called WAVE. Sorry, and because I'm so excited, and sometimes my pronunciation goes to sideways. So WAVE is made up of a group of women and from diverse backgrounds and who provide advice and guidance to City Council on women's gender-based issues and opportunities related to city policies, priorities, and decisions. I'm honored to be a member of this committee, represent our city of Edmonton. We remain committed to building a city where all women feel safe, empowered, and able to achieve their full potential. So today, as we mark International Women's Day, let us commit to praise for progress and inspire positive change. I thank everyone today and for supporting women in our city and helping to break the bias. Your commitment demonstrates Edmontonians' desire to become a city where gender equality and inclusion becomes our new reality. On this note, and to conclude, I would also like to thank Edmontonians for electing 8 women to our Edmonton City Council. Thank you. Have a wonderful day.
Thank you so much, Councillor Rice, for those inspiring words and acknowledging the contributions of women on this very important international celebration and the work that we need to do together ahead on this file. Making truly a welcoming place for all of us. So thank you. I don't see any other protocol items. I haven't had a notice of. Select items for debate. Select items for debate. Who would like to select these items? Councillor Stevenson.
Thank you, Mr. Mayor. I'll select items 3.1 and 4.1.
3.1, 4.1. Those are the items that we have.
Second.
Second by Councillor was Councillor Paquette or Councillor Knack? Councillor Paquette. Okay, good.
We don't have to second selection.
Yes, we don't have to second those items.
Right.
Yeah.
This is a special council meeting.
Yeah, still, we don't have to second the selection of items, right? So 3.1, 4.1, bylaws, none. Private reports, none. We go to that later on. So we are going into our first item, 3.1. We don't have any requests to speak, Madam Clerk?
No, we don't.
We don't have any requests to speak. And request for specific time on agenda, none. And we have vote on bylaws not selected for debate, none. All right, 3.1.
Thank you. Good afternoon, Mayor and Councillors. It's good to see so many of you in 3D. Our COVID-19 journey has included several complex decisions and actions made to protect the safety of Edmontonians and employees. Today's verbal update addresses the impact of the province's March 1st easing of the provincial health measures and sets the stage for a discussion on the city's temporary mandatory face coverings bylaw. It's been our practice, as you know, throughout the pandemic to use these updates to share medical and evidence-based guidance with you so that your debate and decisions are well informed. Adam Loughlin and I will be teaming up to deliver this update today and to set up the discussion. Joining us virtually are members of the executive leadership team. Nicole Poirier and Michelle Plouffe, who are the chair and vice chair of the COVID-19 task team, are also with us. And our guest, Dr. Christopher Sikora, the Edmonton Zone Medical Officer of Health with Alberta Health Services, is here and will be available for questions, but only until 3 p.m. Today's presentation is for information and discussion. And should council wish to direct administration on the next decisions, we're here ready to work with you. As we in Alberta turn to the endemic phase of this virus, learning to live with COVID-19 is becoming a reality. Later this week, the National Day of Observance for COVID-19 victims will be marked for the second year. We know Edmontonians are tired of making sacrifices to keep themselves and others safe. It has been difficult, grinding work to stay ahead of this dangerous virus, and it has tested our community's resolve, particularly given that they are grieving the loss of loved ones and making life-altering adjustments to daily lives and livelihoods. Soon, we hope, public health authorities will declare COVID-19 to be an actual endemic, a disease that continues but is much more manageable and with reduced impact on the healthcare system. Until then, our collective commitment remains to act in the best interests of the people we serve. Our update gathers the advice, opinions, and questions of many partners and experts, all of whom have differing thoughts and opinions on the best way forward. Of course, the city's hands-on experience of navigating the highs and lows of 5 waves of COVID-19 are also essential to inform what lies ahead. We are well aware that there are many divergent voices and opinions on how to proceed. Administration has checked in with residents, with businesses, and with community partners. We've listened and we've learned about what is important to those stakeholders, and we've used their perspectives to guide this discussion with Council today. What is before you is an important conversation about what the city's commitment to people and partners will look like as we balance evidence, opinions, and, of course, passion. We've done our best to incorporate information that you will find helpful. Let's look at our current status. You'll recall this slide as the snapshot of the impact of Omicron transmission in the Edmonton zone since late December of last year. The city, along with its regional partners, experienced a rapid surge of cases in January and a steady decline for the past 5 weeks. In Wave 5, we learned that the health indicators we are used to seeing, like active case rates, have become less reliable and less relevant, with testing now limited to those with severe outcomes and those living and working in high-risk settings. We look at wastewater levels of COVID-19 and system indicators like number of hospitalizations and ICU admissions to inform our thinking. This chart shows that vaccination rates of Edmontonians have held steady for the past month. The latest wastewater data shows a significant downward trend of COVID-19 in Edmonton. The huge spike in February suggests that many thousands of Edmontonians had COVID, but may have been asymptomatic or suffered relatively light symptoms. Of course, there's still a chance that a new variant will affect Edmontonians, which means that vaccinations continue to be a critical tool to help stop or slow the virus. On to the provincial announcement highlights. Effective March 1st, the Alberta government lifted almost all remaining health restrictions in light of a continued decline in COVID hospitalizations and ICU admissions. Step 2 of the province's relaxation plan ended remaining school requirements, including cohorting, capacity limits for large entertainment and sports venues, indoor and outdoor social gathering limits, the mandatory work from home order, and public masking requirements except in high-risk settings. Masking requirements continue on public transit, in AHS facilities, and in continuing care centres. Isolation remains mandatory for anyone with COVID symptoms or a positive test result. These public health protections will remain in place until Step 3 is announced. Please note that while masking remains on public transit, masks are no longer required in vehicles for hire. The timeline for the province entering Step 3 will depend on hospitalization rates continuing to trend downward. When Step 3 is announced, the current plan from the province is that masking on transit will be removed, COVID-specific continuing care measures will end, and mandatory isolation will become a recommendation only. I'll now pass this over to Mr. Loughlin to take you through the next few slides.
Thank you, Katrin. The City of Edmonton's temporary face covering bylaw continues to remain in effect until Council chooses to rescind or change it. On December 13th, 2021, the bylaw was revised as per Council's direction. 2 conditions were added to trigger an automatic review to determine whether mandatory masking should remain in place. First, removal of the provincial mandatory mask mandate, and secondly, the active case rate for Edmonton must be below 100 per 100,000 people for 28 consecutive days. When these 2 conditions are met, Council must review the bylaw within 30 days. As mentioned in an earlier slide on our current health status, the active case rate per 100,000 is less relevant in Wave 5 because testing by AHS is now limited to those who have clinical risk factors for severe outcomes and those who live and work in high-risk settings. Since more people are now vaccinated and Omicron has largely resulted in less severe outcomes, the active case rate indicator provides less guidance for Council's consideration. The bylaw revision in December of 2021 included a case rate per 100,000 indicator when Omicron transmission was accelerating. The chart shows the active case rates, the active cases in Alberta, as well as the active cases per 100,000 population, which peaked in mid-January and has rapidly declined since then. The active case rate in Edmonton per 100,000 was 63 on December 13th, 2021, and peaked at over 1,800 on January 16th of this year. Today, it sits at 131 per 100,000. At the time of the bylaw revision, over 72% of all Albertans of all ages had received 2 doses of a vaccine. This has increased to 76% as of March 6th. Booster adoption in December of last year was just beginning. Only 12% of Albertans had a booster, and this has increased to over 35% as of March 6th. It's also important to note that the delivery of boosters has slowed considerably since February. Council has a few options in terms of the temporary mandatory face covering bylaw. You can choose to maintain the bylaw as is and require face coverings in all public spaces. Amend the face covering mandate to maintain the requirement to mask while on transit and in transit spaces in alignment with the provincial order. Or you can end the temporary mandatory face covering bylaw in alignment with the provincial direction. We've talked with a number of partners across Alberta and have gathered information from across Canada to help inform the discussion. For instance, 10 of the 13 provinces and territories have indicated they intend to lift mask mandates between now and mid-April. Saskatchewan started on February 28th, followed by Alberta on March 1st. Ontario and Quebec are expected to lift their mandates between the end of March and mid-April. Administration completed a robust check-in over the past week to hear and understand the different perspectives in Edmonton about public masking. We heard from members of the business community, operators of large entertainment venues, partner-operated sports and recreation facilities, senior organizations, and the community table, which represents several social and multicultural serving agencies. We also invited Edmontonians to complete an online survey, and we checked in with other jurisdictions like our regional partners in the City of Calgary. The City of Calgary's COVID-19 face covering bylaw, which came into effect on September 4th, 2021, ended on March 1st in alignment with Step 2 of the Province of Alberta's relaxation plan. Masks continue to be required on Calgary Transit under the Government of Alberta Public Health Order. We understand that Calgary administration will not be requesting a bylaw to respond to masking on transit. We've also checked with our Edmonton zone regional CAOs and learned that their municipalities are following the province's plan to end public health measures. Their bylaws, policies, and procedures are aligned with 3 stages in which the province public health measures will be lifted. We have previously shared principles that we would use to guide our COVID-19 decisions. one of the principles is a commitment to protect and promote the local economy. We asked our business improvement areas partners to provide feedback on the implications of the relaxed restrictions. They said in a joint letter to the city, a majority were in favor of having the City of Edmonton's mask rules align with the rest of the province. They said many were in favor of allowing businesses to decide what was best for themselves. They also said many have a deep concern that a continuation of the bylaw without adequate government-funded enforcement will be a significant burden on businesses that have already carried significant weight during this pandemic. The BIAs end the letter by saying, quote, "We cannot in good conscience support the continuation of the City of Edmonton's temporary mandatory face covering bylaw." Jeffrey Sundquist, the CEO of the Edmonton Chamber of Commerce, voiced a similar perspective. Most Edmonton businesses are having difficulty with the mask bylaw and want it revoked. He said, keeping Edmonton's regulations in line with the province and surrounding communities is important to minimize confusion and to ensure the businesses are competitive with those outside of the city limits. Stakeholders have voiced differing sentiments about the mask bylaw. In general, sport, recreation, and entertainment facility operators, businesses, faith-based organizations, and vehicle for hire groups are against keeping the bylaw in place, although some said they would require staff to continue to wear masks. Senior groups and social serving agencies largely support keeping the bylaw in place, and a review of local universities and college websites note that they intend to keep mandatory masking on campus for faculty, staff, students, and visitors. The Government of Canada is requiring masking to remain on public transportation systems, including boats, railways, and airlines. We heard a mix of opinions from social serving agencies. Those in favor of continuing the mask bylaw believe the province is moving too quickly, while those opposed prefer to follow the provincial public health order. We also heard that many of these organizations would choose to continue masking regardless of an official regulation from any level of government. Facility operators and business owners from across the city have shared their experiences and perspectives with members of ELT on the mask bylaw enforcement issue. For example, a local curling club manager indicated that while he personally felt it was early for the province to remove their mask mandate, it would be best for the city to follow their lead. The club was seeing compliance problems with their members when there was a difference between the provincial mandate and the city's bylaw with respect to kids under the age of 12 wearing a mask. It created lots of confusion, and some parents were adamant that their kids should not have to wear a mask. Similar concerns were heard about enforcement from soccer center operators, local ski hill operators, and others. Hospitality and entertainment venues such as the Edmonton Expo Centre and Edmonton Convention Centre report that the city's mask bylaw challenges their ability to host events, meetings, and conventions. The seating and food and beverage consumption restrictions are particularly difficult to manage for receptions, dances, concerts, and sporting events. The Oilers Entertainment Group also reached out to the city manager and expressed that they prefer alignment with the province. And with that, I'll hand it back to Ms. Owen.
Thanks, Adam. An online survey seeking feedback about the city's face covering bylaw was conducted between February 28th and March 7th. The preliminary results presented here, however, are from surveys received between February 28th and March 2nd, because we needed to do some verification of the data. These include over 66,000 respondents. Given the high volume of responses, we wanted to ensure the validity of the data from the survey. We needed time to complete a review and validate that data. For instance, we removed duplicate survey completions and other invalid responses. The preliminary results of that survey are shown on this slide. It's important to mention that this was a record-breaking survey for the city. The response rate was significantly higher than we have experienced previously for other popular topics. For example, the 2021 budget survey had just over 8,000 respondents, and the recent snow and ice survey that closed yesterday had over 19,000 respondents. As of last night, when the face covering survey closed, we received a total of 79,200 responses. A full report on this data will be available to council members and Edmontonians on our open data site in the next couple of weeks, and we will include all valid data from the entire survey period. There were two main questions asked. The first was, do you think wearing a mask should still be required while visiting any indoor public spaces in Edmonton once the provincial mask mandate is lifted on March 1st, 2022? And the second question was, do you think wearing a mask on public transit, bus, LRT, DATS should still be required after March 1st, 2022? In general, the people we surveyed said that they'd like to remove the bylaw at about a 2-to-1 margin. For transit, the results were closer, with 53% against keeping the bylaw and 43% for keeping masking. A further breakdown of the data from a GBA Plus perspective indicated that women were more likely than men to want to keep the bylaw, but still less than half of all women wanted the bylaw to remain. The older the respondent, the more likely they were to want the bylaw to remain, but still less than half of senior citizen respondents wanted the bylaw to stay. And the lower the reported household income, the more likely the respondent wanted the bylaw to remain. But again, still less than 50% of the lowest income bracket wanted the bylaw to stay. A check-in with city staff in resident-facing operations also informed our analysis. Community recreation facilities are reporting approximately 90% compliance with the city's face covering bylaw as we use an education-first approach to enforcement. Staff are providing information and offering a mask to those who arrive without one. Staff are reporting some confusion among patrons due to the ending of the provincial health measures and the continuation of our mask mandate. Signage has been updated in all facilities. There have been a number of incidents of non-compliance, including yelling and swearing. One incident resulted in escalation to EPS. Staff have been trained in de-escalation techniques and have been told to not engage if patrons become angry or aggressive. Edmonton Transit is seeing approximately 95% compliance on buses, LRT, and in-transit stations. Audio messages are being played to remind people of the provincial order requiring masks on transit. There have been no significant enforcement issues related to masking on transit. We understand that the Edmonton Transit Service Advisory Board sent a letter to council members yesterday, and we understand their perspective in respect to keeping masks on transit and are continuing to reinforce this message through education. Edmonton Public Libraries are seeing 90% compliance across their locations. More and more patrons do enter without masks, but comply when asked to wear one. For the few patrons who are not happy having to wear masks, EPL is taking the same approach as our recreation facilities to educate people that the mask bylaw in Edmonton currently remains in place, and they offer the patrons a mask. If patrons refuse, they're permitted to enter the facility in order to not escalate the situation. Other considerations. Our COVID-19 response principles, as Adam mentioned, guide our decisions. Our first principle is that the advice and guidance of the Chief Medical Officer of Health for Alberta informs whether it's safe to relaunch facilities, services, and programs. We are not, as we have said all along, medical experts, and the Chief Medical Officer of Health for the province of Alberta has signed an order indicating that masks are only required on transit and in high-risk locations. There are a number of inconsistencies currently between our bylaw and the province's recently rescinded order. We are of the view that a consistent approach to masking within the Edmonton zone and across the province would alleviate confusion of residents, businesses, and visitors when accessing services from public and private providers. We're also of the opinion that setting a regulation that exceeds the health authority can be difficult to justify, as we lack, as we've said, the medical expertise and the scientific insights of epidemiologists. Without an order from the health authority, it may be difficult to obtain compliance from patrons. The burden of administering and enforcing would rest with frontline workers, staff, and servers. And we've seen and heard how this can lead to unwanted confrontations with unhappy, vocal people. Now, as we get to the end of the presentation, I'd like to remind Council of the three options that Adam outlined to you. End the temporary mandatory face covering bylaw in alignment with provincial direction, or amend the face covering mandate to maintain the requirement to mask while on transit and in transit spaces in alignment with the provincial order, or maintain the bylaw as is and require face coverings in all indoor public places. Based on administration's review of the research and the information that we've gathered, our best advice to City Council is to rescind Bylaw 19408. Although we recognize that your governance role is complex and multifactorial, and that your decision-making must take into account a variety of nuances. We're prepared to work with you to develop any further motions that provide direction on the potential options at hand. And if you want us to create or amend bylaws to implement any of the options that you consider, we will need some time to ensure that they're properly crafted by our legal specialists and they are practical and implementable for Edmontonians. With that, Adam and I are happy to take any questions you may have. And just a reminder that Dr. Sikora is with us, but only for 20 minutes or so.
Thank you so much for that. So what I would suggest is that council members, if you have questions to Dr. Sikora, let's ask those questions to him first so that we can utilize his time as best as possible. Then we can come to administration for questions. So, Councillor Paquette, do you have questions to Dr. Sikora?
Sure.
Go ahead.
Okay, Dr. Sikora, today in the brief time we have, are any of the responses we're going to get, will they differ at all from the position of AHS? I think you're on mute.
Sorry, Councillor, could you clarify?
Well, the position of AHS and their advice to the province, we don't actually know what that advice is, but is anything that you're going to share with us today at odds with the position of the province?
So I would be supportive of taking steps that are considerate and consistent with what Dr. Hinshaw, our Chief Medical Officer of Health, put forward around masking.
Thank you. All right, that answers the question. So pretty much know that position then. Okay, so then I'll just move to administration.
Councillor Paquette, let other council
when
members.
I get a chance on my,
we'll come back later on. So
for Dr. Sikora.
Yeah, we'll just focus on Dr. Sikora first, right? So Councillor Knack.
Thank you, Mr. Mayor. Thank you, Dr. Sikora, for being here. Are additional waves of COVID expected?
Difficult to make a guess on that, Councillor Knack. I suspect as immunity can and will wane with our good immunization, but future campaigns, there will likely be small blips into the upcoming months to years. And I think that does coincide with what those expectations are around COVID becoming much more of an endemic type illness, very similar to how we as a society have managed.
Do we have any data? Thank you. Sorry, and I'll be quick because I know you have limited time. Do you have any data to suggest that future waves will be more severe, less severe, equal severity to something like Omicron at this stage?
I don't have any data on that. I'm sorry, Councillor.
Okay. So we similarly, we wouldn't know if we would be expecting a similar number of deaths to the Delta or Omicron wave in a future wave. Hard to estimate at this point.
Yeah, I wouldn't be able to estimate. I'm sorry.
Okay, no, that's fine. I appreciate that. Would the retention of any public health measures help with addressing potential, less or more severe outcomes going forward into future waves? And I guess if so, do we have any data to suggest to what degree public health measures would help with that?
That's a great question. So our broad-based public health measures like masking, immunization and hand washing, staying home when you're sick, work from home, were very successful in helping protect the healthcare infrastructure. And as we retain that ability to respond from a healthcare perspective, I think the reasonableness of reopening in the stage sense is there. What it does put forward is that we know those tools, we have an awareness of how they can be applied in various circumstances, and those are tools that are open for use into the future should we as a society need those. So I think we have a keen awareness of what tools are there, just what circumstances would have to be in place. Should we reapply them is perhaps a broader discussion, and one that likely would take place at both at the federal level, but also at the provincial level.
Perfect. And similarly, we wouldn't have any indication at this stage as to how particularly masking would help or hinder or impact at all future waves. We have a general assumption that masks have been effective. You've talked about that in the past. But as to how effective they would be as vaccinations continue to rise, as different changes evolve, we don't know that. Is that fair to say?
I think that's fair to say. We do have an understanding that masking is both beneficial for the individual, but also for the society overall. My mask protects me. My mask also protects you is some of the common phrasing that we have used. I think as a society, we've learned what we can do together to help keep our workplaces, our families, and our learning settings safer. And some of those learnings we do expect to transition into the upcoming months to years, and those being the hand washing, the wearing a mask as a strong recommendation, staying home when you're sick, and doing that safe for work, safe for play, safe for learning type symptom checks.
Appreciate that. Last question. Do you have any insight into the science that's being used to justify why masks are still being required on transit, but say not in other enclosed settings, such as a smaller meeting room where there might be people gathering? I'm just not familiar of why a bus would be different from a meeting room versus any other small enclosed space.
I can't speak to the exact discussions that had taken place during that. My sense would be that transit is less of an option. So going back and forth between workplace, schools, or such in a private vehicle would be less risky. Just that the mass gathering and utilizing transit often is not a choice.
And I guess more important, so not so much in a vehicle for hire, but say an office setting where people might gather in a meeting room that can house 6 people. Is there any evidence or data that would suggest that is less risky than being in an enclosed bus with individuals?
I'm not sure about less risky, but rather on our city bus or other transit locations, there would commonly be a very different mix of individuals, different every 5 minutes, every 15 minutes, versus an office space where it's quite often the same 6 people every day.
Thank you. That's my time. I appreciate it.
Thank you, Councillor Knack. Councillor Tang, questions for Dr. Sikora?
Yes, thank you, Mr. Mayor. Hi, Dr. Sikora. Based on your current projection, when do you think we'll hit that 100 per 100,000 rate?
I have a difficult time answering that, Councillor Tang. The 100 per 100,000 rate isn't really a good, reliable measure any longer. The testing criteria using PCR-based methodology had changed early in 2022. So while we do have a particular number, I don't really have nobody actually has good, strong confidence in that.
Fair enough.
The numbers of COVID cases in our broader community will be much higher.
Yeah, so the indicator we have right now is unreliable. Can you educate me a little bit on the strains right now? For example, the Omicron BA2 currently, is it more contagious or less contagious than the BA1?
So we are still continuing to learn about the Omicron variants themselves. BA2 does Well, I think it comprises about a quarter of the tested samples in the Alberta environment. It does not appear to be any more or less virulent or pathogenic than the BA1 version of Omicron itself. And it seems to, at least appears to have, very similar immunization, or at least vaccine effectiveness capabilities.
Okay. Are you doing any tracking for the impact of long COVID?
We are, as a healthcare system, long COVID was brought to our attention last year at some point, and we have set up task groups both within our zone, so Alberta Health Services zone, but also provincially in coordination and collaboration with our universities and our strategic clinical networks and our primary care partners in the broader community. So we are and have developed long COVID pathways, because I think from what I recall, our best evidence is showing that about a third to half of individuals who have been affected with COVID will go on to develop some symptoms that are related to long COVID itself. It is a big issue, and we have taken steps to help create those treatment pathways.
And I guess in the long term, what would you say would be the impact of many of the measures that you had talked about, whether it's masking or hand hygiene or staying home when you're sick, sort of impact on those kinds of impact?
Sorry, can you clarify, Councillor?
Yeah, I guess I'm just wondering in terms of some of these long-term impact measures that we're talking about today, would it affect those long-term conditions or improve?
I don't think a stay-at-home order will have much effect on the prevalence of long COVID. Rather, the public health measures that have been put into place over the course of 2021 and 2022 were designed with protection of the healthcare infrastructure and reducing transmission events overall. I think our mantra was flatten the curve, and that it did. Certainly give us and buy time to be able to develop those immunization strategies and those immunization programs that could be delivered. So continuing to support and promote immunization is something that's very important. The advice will be changing with time as new products come on board and other different age groups become more eligible. Hand hygiene, staying home when sick, masking as a recommendation are all very important things to help you keep safe and healthy, but those are all designed to reduce transmission. Conveniently, those are the same tools that can be utilized in influenza seasons as well.
And my last question, since March 1st, do you see how do our trends here, as much as unreliable they are, but it is what we have, how do we compare against Calgary?
I don't have off the top of my head how we compare to Calgary. Since the beginning of the year, and I believe the information was included in the information packet, our ICU numbers have been stable or slightly decreased.
What's in our package is is definitely Edmonton related. I guess I'm more trying to ask about, in one city we have this measure, in one city we don't, and I'm curious about how they kind of stack up. But if you don't have that ready, that is okay. I can follow up later. Thank you.
Yep. Thank you so much, Councillor Tang. Councillor Wright, questions to Dr. Sikora? You're on mute, Councillor Wright. No, still can't hear you. No. I'll come back to you. Why don't I go to Councillor Rutherford until you fix your system. Councillor Rutherford?
Thank you, Mr. Mayor. So I guess one of the things I struggle with is sort of a context question. So for you, Dr. Sikora, I'm looking at the data, and, on February 1st, for example, a mere 5 weeks ago, 35 days to be exact, Alberta recorded its highest number of COVID-19 hospitalizations. And that was, 4 weeks. Since then, the government of Alberta lifted the masking restrictions as well as others. And the health minister has clearly stated that their reopening depends on trends and that they're willing to reimpose restrictions if they have to. So what I'm trying to struggle with is we've seen these peaks and valleys happen with the lifting of restrictions and the re-implementing of restrictions again and again and again in coinciding with the waves that we've been having. Is there some context piece that I'm missing that is different this time than previous times of lifting restrictions?
I don't think there's a substantively different context piece. Certainly our province, and much like every one of our other provinces, is learning from other jurisdictions and reopening and lifting restrictions and measures as the data supports. Around Omicron itself, one of the key learnings was that it was a relatively rapid rise and then a relatively rapid decline. So perhaps that helps.
Yeah. And then I wanted to ask you this question because it's something that's come into my inbox a lot around the difference between somebody that's a public health expert and somebody that's a medical doctor. Often they overlap. There's definitely a synergy there, but what, in your expert opinion, is the distinction between public health and patient care?
So public health practitioners and public health physicians, and I am a public health physician. There are a core group of us who have completed Royal College training in public health preventive medicine and have expertise in working with organizations and primarily with populations. So when I put my family physician hat on, my care is the person in front of me.
Yeah.
When I put my public health physician hat on, my exam room becomes a boardroom. My vital signs become the epidemiology and the statistics that are collected, and my patient becomes a population. Decision makers in a public health realm are often elected officials and communities. So we work with communities, we work with administrations, we work with organizations and elected folks to be able to best advise what particular health interventions are on behalf of the population.
Yeah, so I think you said thank you for that. That's a really beneficial and I think important for the public to hear that. I think you said something really important about prevention within that sphere of public health, right? If somebody is an individual patient, they're usually already most often dealing with some sort of health issue already. I guess at the beginning of the pandemic, we used the words protections and prevention in terms of public health measures, and now we've sort of switched that language to restrictions. Is there something again that I'm missing in terms of that change in language and semantics?
I don't think so. Again, I'm reflecting the language that has had or that has been used in our province. Certainly, phrasing around protections and prevention and keeping individuals and families healthy is a very appropriate way to communicate this as well.
Perfect. Thank you so much. I appreciate your time today.
Thank you, Councillor Rutherford. Councillor Wright?
Can you hear me now?
Yes, we can, yes.
Okay, thank you. Dr. Sikora, recently, just over this weekend, I heard that the Canadian Medical Association made a comment that the virus is still with us and unfortunately will be with us for some time, and that our pandemic measures should be scaled back safely and gradually based on scientific evidence. I'm just wondering, what scientific evidence, I guess, can you provide us that the province's elected officials have had available to them? Besides just some of the data that we've got here today.
So I can't speak to the exact information and data that Dr. Hinshaw and our Chief Medical Officer of Health team would have briefed the provincial government on. In terms of looking at where we are at across the Edmonton zone, I am reassured by the primary COVID diagnosis of admission gradually coming downwards. I'm reassured by the wastewater surveillance showing decreasing counts overall. There still is going to be a bit of a sawtooth pattern on the way down. Our test positivity has reduced from 40% down to about 20%. Our ICU usage is reduced. We still do have exceptional beds open across the province, but there are 31 COVID hospital admissions in the critical care space within Edmonton zone proper, which is stable and has been decreasing for a number of weeks. And also quite reassured by a stable and plateauing nature of our immunization overall.
So that immunization, I'm just like, so Alberta's sitting at, I think it was 76.1%. And there's other provinces that are higher. Ontario is over 80, Quebec is 82, 83. And yet they're holding back on some of their, removing some of their protections. And even some of the cities, like Toronto specifically, even though Ontario might be removing it, Toronto is looking at keeping their masks in place. I'm just wondering why Alberta would take this approach, or why Edmonton should take this approach to remove all those protections when our immunization is lower than other provinces.
You know, I can't really speak to that, Councillor Wright. It certainly is reasonable to coincide with our Chief Medical Officer of Health advice, and certainly orders in terms of masking in those very specific places of higher risk, being AHS and contracted facilities, and then our public transit environments. And again, the decisions in other jurisdictions I can't really speak to.
And then my final question is going back to the wastewater that you'd mentioned. What did you call it? The peaks or the teeth or whatever. It seems to be similar because it's back on the increase now again. And it seems to be similar to what we were experiencing during the Delta wave. So again, why is that different now than it is with the Delta to be loosening up on those protections?
Yeah, just as the wastewater peak comes on the downward slope, there'll probably be these sawtooth patterns on the way down. It is gradually becoming lower. So the impression is that according to the wastewater, we're getting better. And that's highlighted also by our admission, but also our test positivity nature numbers as well.
Okay. Oh, because what I'm looking at here is it seemed to come down when the province removed the restrictions exemption program, and then looks like over the past couple of weeks past week or so has been on the incline. Maybe I'm not.
It did have a bit of an incline in the last week or so, yes.
Yeah. Okay. And that's since the removal of the restriction exemption, right? Yeah. Okay.
Well,
okay, that's all the questions I have for now. Thank you very much for your time.
The move to stage 2.
Yeah, thank you, Councillor Wright. Councillor Stevenson, to Dr. Sikora.
Yep, thank you. So yeah, just picking up from Councillor Knack's questions. So just to clarify, you know, the continuation of mask requirements on transit and in healthcare facilities, that does suggest that masking does have a positive impact on reducing transmission. Is that correct?
Masking is one tool of many that can help reduce transmission events from occurring, yes.
Great. So, you know, you mentioned the importance of protecting healthcare infrastructure. So just looking at the hospitalization rates and ICU rates, can you just confirm, are we sort of back to a point where all regularly scheduled surgeries are happening? There are no longer those disruptions that we were hearing about late last year? Is our healthcare system, you know, running smoothly, not over capacity at this point?
So our within the critical care environment, we still are at over capacity level. So we have it based on 173 spaces, and we're about 60 above that right now. But the COVID admission numbers in them are relatively low. We have an initiative within Alberta Health Services called the Alberta Surgical Initiative, and that is intended to help get all those surgical backlogs taken care of, to be able to help address those needs for those individual patients themselves. We're well on the way to helping do that, and it's one of our main activities that will be over the remainder of 2022.
Great. And sorry, just to clarify those, so those regularly scheduled surgeries are proceeding right now. There are no further delays or postponements happening?
I don't have specific numbers on or an update on if they're fully moving, but it's one of the initiatives that is in place right now. So we're working on it.
Okay, and then just in terms of sort of the healthcare provider, you know, burnout, retention, what's the status there? Just recognizing that there have been these 5 really intense successive waves, and just wondering what the overall health of the healthcare system is from the folks who work in it.
We have worry as a healthcare system for all of our providers, from our frontline nurses to our physicians. This has been a very challenging and very difficult past 2 years, and many environments have implemented and instituted sort of peer support and other support measures to help take care of health, and mental health and is part of personal health. So we do have worry about that. We're keeping an eye on it, and is one of the things that we are working on, as are all of our colleges and associations.
And I just want to clarify on vaccine uptake. There are 2 different numbers presented in the slides before us today. So just to clarify, you know, looking at 5 and up, the vaccine rate is about 40% for 3rd dose. And then, sorry, on another slide, on slide 8, we saw that it's at about 38%. And again, is that just total population versus the +5?
Can I turn that over to Ms. Owen or Mr. Laughlin?
I can follow up with them when we use the time. And just what efforts are being made to increase vaccine uptake? Because again, it's looking like it's not a majority of Albertans have the 3rd dose, which is seen as really critical.
So increased accessibility is one of those primary things. So making things as accessible as possible. We have opened walk-in and sort of drop-in appointments, both for adults, but also for the under 17. Accessibility through multiple venues, whether they be pharmacy or other public health locations, has been part of that as well.
And are those new initiatives? And what has the uptake been since those were introduced?
The drop-in has been a relatively new initiative, but I think in many circumstances, individuals who have already made their decisions around immunization have already made their decisions.
So you're not anticipating an increase in the vaccine rates? Is that what you're saying?
I think it's going to be exceptionally challenging to be able to get a substantive increase in our immunization uptake rates.
And what do you think the difference is between getting 2 doses and 3 doses?
In terms of protection, or in terms of want or willingness?
Want or willingness.
That's a topic of many PhD theses around what is the core of vaccine hesitancy, and in many circumstances it's trust or awareness, or helping address what are those core hesitation concerns. We have taken steps to help address them as best we can.
Or regulations as well.
Okay. Thank you, Councillor Stevenson. Dr. Sikora, would you be kind enough to stay a few extra minutes? We have Councillor Salvador, last council member, to ask questions to you.
Oh, certainly.
Thank you. Councillor Salvador?
Great, thank you, Mr. Mayor, and I'll try to be succinct here, Mr. Sikora, but I'm wondering if you can just start by explaining the transition between pandemic to endemic and where that line is.
Not always a clear line. I think as we move into an environment where we have good immunization coverage, and where we have a virus that does circulate in waves and circulate over time, we will get things into more of endemic nature. So we have good immunization coverage at this point, so better than 70% across our population. We have treatments that are new with oral antiviral, but also a monoclonal antibody set. We have an ability of our healthcare infrastructure to be able to respond. And we have more tools and resources from an organizational perspective to be able to support those things that help reduce transmission, whether they be physical barriers, whether it be work at home options for individuals, And then we have those societal learnings that are associated with helping keep each other safe. Those individual choices that we have around hand washing, wearing a mask, staying home when you're sick, getting access to testing.
Okay, yeah.
As COVID really ends up being no longer a novel virus, but rather something that comes around on a regular basis, that's when we end up shifting more to an endemic phase.
Okay, well, I appreciate the answer there and recognizing that, that is a gradual transition. I think that's the key word there. And yeah, I guess I would wonder, knowing that masks are one of many tools and really one of the more easy, simple lines of protection. Do you feel that is part of that gradual transition? You'll being able to maintain one of our last lines of defense as we transition potentially to an endemic, depending on the evolving situation?
I think it's a very good tool. It's one that has been successful. We've taken the direction from our Chief Medical Officer of Health and have taken the notion that it's now is the time for us as a population to be able to move from things being mandated to make things being recommended. And I think that's a very reasonable thing to do at this point in time. Certainly those very similar discussions are being had around things related to the testing, around treatment, and other measures. Certainly it's also seconded by a gradual shift to focusing on things like long COVID. So I think it's a very reasonable undertaking to do at this point in time.
Okay, and I guess just building on that, I am really trying to understand what has changed over the last few months that gives that really clear indication that removing that last line of defense is reasonable. And I guess, that's something I'm struggling with, knowing that hospitalizations are still quite high, wastewater is still, I believe, at essentially the peak of previous waves. Is there any additional, I guess, data or surety that you can provide around this being the right time? Because it feels like I've seen this happen before. We all have, and I'm wondering why it would be different, I guess, and looking for, again, that hard evidence that it will be.
Yeah, and I don't think I can provide the reassurance. Rather, the option and perhaps the reassurance is that there can always be further measures implemented into the future as either the data supports or, well, if the data supports, and certainly being able to, as outlined by our administration, coincide with what advice and measures have been put forward by the Chief Medical Officer of Health is certainly being reasonable. But any of those decisions around masking that go over and above what our CMOH direction is do come at risk and cost, and those would have to be part of a broader discussion within Council.
Okay, and just really quickly, last question. It was brought up previously around different strains, variants of COVID. I know there's some emerging research coming out around BA2, as was mentioned, and I guess I'm quite concerned about what that could mean, of course. And again, would we expect similar strains, similar variants, potentially that have greater number of breakthrough infections to be possible at this stage of a pandemic?
It certainly is possible. And certainly our virologists and our public health laboratory experts are across Alberta, but also across Canada and internationally, are keeping a very close eye on variants. And there are variants of interest that just will show up. And then there's variants of concern that either may have increased pathogenicity, increased transmissibility. So it is something that will have to be kept a very close eye on, much like how we keep a very close eye on emerging influenza strains every year as well.
Great. I'm out of time, but thank you so much for those responses. I appreciate it.
Thank you, Councillor Salvador. And thank you so much, Dr. Sikora, for your insight and your time, and always being there to give us your best advice. We really appreciate that. And thank you for staying a little longer than your scheduled time. Appreciate that.
Okay.
Good.
Thank you for the opportunity, and best wishes with the discussion this afternoon.
Okay, thank you so much. Okay, all right. Okay, can someone move that we go to the second round, please?
So moved.
Thank you, Councillor Salvador. Seconded by?
Second.
Seconded by Councillor Knack. Any questions on moving to the second round? Seeing none, please vote.
We have all the votes.
Display the votes, please. Vote is carried. Can you, I'll just wait for the list to appear. I think was Councillor Paquette was first up. Councillor Paquette?
Okay, yeah, so we're good to go?
Absolutely, we're good to go.
Okay, great, thank you. Okay, so a quick question for administration. I was a little bit concerned hearing that we had to remove, I'm sure it's common practice, remove a number of responses for being duplicates and things like that in validating our data, which we haven't completely done yet as well. These are just preliminary results. But I'm also wondering if we do location verification as far as ISPs, things like that, to ensure that the responses that we're getting are actually local.
There aren't any restrictions on whether or not an IP address is in Edmonton, Councillor. We wanted to be able to have visitors to Edmonton, those who work here but may not live here, those who visit here for recreational purposes, to have a voice in this research as well.
Okay, that kind of throws the scientific nature of the survey right out the window, though, doesn't it? If we can't verify that we're getting responses that are from Edmonton or region or even province.
We use the same criteria for this research as we use for all other open surveys of this nature. So
sure, but not all other things are as wildly and nationally and internationally politicized.
You're correct.
And so that's pretty concerning. So we have no way of knowing whether or not organizations have said, hey, look, City of Edmonton is having a survey. Let's make sure everyone goes and votes.
We do know that we don't have any duplicate surveys or any duplicate responses from individual IP addresses. That is the data cleaning that we have been able to do. Okay, fair enough. Yeah, and I don't blame the methodology in any way, because usually it works well. Okay. So, but I think it's important to indicate that, because we're dealing with reality. Okay, so there was also a phrase that said in the presentation, learning to live with COVID and moving into endemic. But we heard from Dr. Sikora that we could potentially at some point move toward endemic status, but we're not quite there yet. So I'm just wondering what learning to live with COVID actually, how we're supposed to take that as far as practical application. We were simply, Councillor, using the language that is currently in play with our health experts, echoing, we felt quite accurately, what Dr. Sikora said. Okay. To put it bluntly, there are a number of families in Edmonton whose loved ones will never be able to live with COVID because they're gone. Okay, so moving on, we also heard that there's a very good possibility of another strain coming up. Especially if the Omicron variant, and it's more virulent, and because it is far removed, and each mutation is moving us further away from the original strain, vaccines become less and less effective. So I'm curious about, I'm assuming that administration's best advice for
lifting the mask mandate has less to do with the health data and health knowledge that we have about how this virus behaves and how the variants behave, and more to do with the logistics of it. Is that fair to say?
I think, Councillor, it's more about clarity for Edmontonians than logistics. I think we've managed.
Okay, so clarity rather than health really based.
Working with the health information that is available to us. We have.
Yeah, and I don't blame you at all. I mean, we're just not getting that data in any way, shape, or form. Everyone is operating pretty much in the dark.
Just something to add to that, Councillor Paquette, we're not the health authority. You've heard me say that a number of times throughout the years.
And that's not the setup we have in Edmonton. Maybe in Toronto, but not here.
Correct. You're absolutely correct. Different in different parts of the country.
Yeah, so I'll have more questions, but I'll leave it at that for now. Thank you.
Thank you, Councillor Paquette. Councillor Knack.
Thank you, Mr. Mayor. So I've heard again, and just so I'm 100% clear, we have not seen the recommendations made by the Chief Medical Officer of Health. They have not been released to anyone in the administration, neither to the mayor. Is that correct? We made that request, but I just want to make sure nobody has received that. Is that correct? Okay. Yeah.
That is correct, and you heard Dr. Sikora say a few minutes ago that he hasn't had access to it either.
Correct. I just wanted to make sure. So, and maybe it's a little too early, but Bill 4 just was released. So I don't know if there has been I've had a chance to quickly scan because it's a very short bill. Can I ask questions about that now? Or are we prepared to answer questions on that?
You can, yeah.
Thank you. One of the sections of the new bill suggests that that municipalities would not have the ability to, or rather, unless approved by the minister, would not be allowed to bring in a bylaw. And then later on talks about that the minister shall consider the public interest and consult with the Chief Medical Officer of Health in determining whether to approve a bylaw. So how I read that is that instead of a decision before us today as to whether we should repeal it or not, we could submit the existing bylaw for their review, and the Minister of Municipal Affairs would engage with the Chief Medical Officer of Health to determine whether our bylaw is still needed. Is that a fair interpretation based off an early read of this bill?
Going to ask Ms. Plouffe to weigh in on the early interpretation.
Thank you, that would be great.
So, Councillor, yes, we could submit our current bylaw for review. They could also repeal our current bylaw.
Understand it, but I guess if their goal is to review it and they're going to review it with a Chief Medical Officer of Health, is there value in us submitting it on behalf of folks to get a sense if there is a medical rationale to continuing it? Because part of the struggle we've just discovered is that none of us have access to the recommendations of Dr. Hinshaw. They have not been made public. So if we could submit this, if that would be an option, then we would be able to get a clear ruling from the Minister of Municipal Affairs with guidance from the Chief Medical Officer of Health.
So are you suggesting we would submit it in short order? So the bylaw is just passed, and the legislation has just passed first reading. So unless we would do so after the legislation has been proclaimed.
And I guess that's part of what I'm wondering, because I think there might be value. We're sitting in this uncertain world without good medical data. And if there is an opportunity to put a bylaw before our chief medical experts, I think that would be really valuable for me. And if they say no, well, then they've done their review, they've done their due diligence, they've used the advice. But it feels like that might be a worthwhile exercise for us, or at least something we should consider as part of our discussion today.
I guess, Councillor Knack, the only thing I'd add is that the province made that decision across the province on the basis of that advice. So absolutely, you could do it. I could predict what the outcome would be.
The answer might be no. I guess my thought was, I thought they were going to introduce a bill that essentially said you can't do it either way. But the bill says, in fact, they'll engage our Chief Medical Officer of Health, which feels like a more I mean, while I still think it might be a tad of an overreach to change the Municipal Government Act, it would have been nicer to just have that conversation, order of government to order of government. It may be an interesting way to understand every aspect and maybe get access to that information, or at least make sure that a decision that's ultimately being made has had the guidance of the Chief Medical Officer of Health. So that's more, I realize that's a little more rhetorical, so I'll move on to this. A few other questions that I'd like to ask. Actually, the only other ones would be getting the update from the mayor as to what he's heard, so I'll wait for that appropriate time. Thank you very much.
Thank you, Councillor Knack. I think what you explained was what I was going to share with you in private until it became public. So I don't think we probably need to go into private to do that now anymore. Councillor Salvador.
Thank you, Mr. Mayor. So I also had some questions around just our sort of methodology validity around the survey and those record-breaking numbers, but those have been mostly answered. So I'll ask some questions just around compliance at city facilities, transit, at our libraries, because I know in the presentation from admin, you spoke a little bit about some of the confusion that folks experience, and I'm just trying to square that with our quite high compliance rates. You know, I think it was around 90% city facilities, 95% ETS, 90% for EPL. So I'm trying to understand that. It doesn't seem like there's too much confusion. When was that data gathered?
I think the confusion that we're referring to is the feedback that we received from business, that in the city of Edmonton, there's a mask bylaw outside, there is not. And as business, it makes it confusing for patrons. We have folks online for each of the city facilities that we measure, and they could provide specifics on each of these if you'd like, Councillor Salvador.
Sure, yeah, I guess that helps clarify that it's not, and correct me if I'm wrong, Mr. Loughlin, but it's not necessarily that it's city facilities, transit, it's more so the private businesses where that confusion is being experienced, is that correct?
There's that, but I think Mr. Jevney has something to add related to rec centers and confusion, probably because we have external to Edmonton attendees. Go ahead, Roger.
Yeah, that's where we're getting the greatest confusion, Councillor, is with facilities like arenas where teams travel across the region. As people come into Edmonton, there's some confusion. We do have masks available. They generally take them, and we're seeing good compliance. But once they sit down in the venues, they also are prone to take them off when they have a cup of coffee and treat it more like a restaurant than a rec center.
Okay. Well, thanks for that explanation. I guess one of the just overarching concerns I have about this conversation is I want to make sure that our decision making is really rooted in science and data. And I hear some of those concerns around confusion, potentially compliance, but also just around what I would almost call bullying of frontline staff. And I question whether repealing a mask bylaw in order to deal with some of that bullying or harassment is really the right mechanism. I feel like we should be directly addressing that behavior through correct channels. So if there's any comment on that, I'd be curious to hear some thoughts there. Because again, absolutely recognize that frontline workers are experiencing that, but I don't necessarily believe that making public health decisions based on that bad behavior of folks who are displaying kind of antisocial behavior is necessarily the right move.
I think we were identifying, Councillor Salvador, that there's many considerations in terms of why we landed on this advice. One of them is frontline employees are the ones that are typically in the situation to deal with this. And from a GBA plus perspective, those aren't necessarily always the individuals. And I'm not talking about City of Edmonton specific, because our staff are actually trained to deal with conflict. But across the board, all businesses, you get into a situation where those folks are left, unfortunately, dealing with this situation, and where there is uncertainty or inconsistency, that's where it becomes a challenge for those folks. And so it's not the consideration, it's one of a few considerations.
Right. Right. Okay. And I guess, have we given any consideration to potential resources or help or assistance that the city could provide to folks who are in that position to mitigate those instances?
I would ask if anybody on the call could support with that, but I think the answer is probably not, because we're in a bit of situation that's happening on the fly here. So we haven't sat down to figure out exactly how we could support. I would just say that our resources from a enforcement or peace officer perspective are stretched. So that does become a challenge to be able to support from that capacity.
What we have done, Councillor, throughout the pandemic is support businesses in particular with materials that they can use to communicate to their patrons what the rules are and what level of the level of compliance that's required. We can continue to assist with communications tools, but to train at the individual business level is beyond our capacity.
Okay, I'm out of time. Thank you very much.
Mr. Jones, you want to add something quickly? David?
I was just going to add that from a peace officer perspective, we don't have any authority to go into private businesses. Our municipal enforcement officers could go in, but that would be more for business licensing purposes than for supporting businesses with patrons who are unruly. That falls to the EPS.
Okay. Thank you, Mr. Jones. Councillor Stevenson?
Yes, thank you. So just following up on this survey, so it sounds like we do have access to the IP addresses of individuals who submitted responses to remove the duplicates. Is there any reason why we wouldn't want to sort by location in this instance?
I would need to check to see if we have the capacity to determine the geography as well as the duplication. And if Ms. Turner is on the line, or Pallavi, you might be able to answer that more precisely than I just did.
Thanks, Catherine. I'll turn this one to Pallavi, as she's our expert on the survey.
So we did check for geography, but unfortunately we could not check it to Edmonton level. We did check for country level, and majority of those responses were from Canada. The only few responses that were not from Canada had some comments that kind of pointed that these individuals may be from Edmonton, living outside currently, but are interested or have a house in Edmonton.
One of the things that we can share with you as the meeting proceeds is the Insight community who answered the question, which are a specific group within that larger cohort of respondents, are all Edmonton-based. And what I'd like to be able to share with you, if I'm able to during this meeting, is what those results are as a microcosm of the bigger results.
Yeah, thank you for that. I think that would be of interest for sure. So then, just pivoting to some very preliminary review of the legislation that's currently proposed in Bill 4. So I understand there's been first reading. What is the anticipated timeline on second and third reading as well? Do we general sense of when this could go into force?
So I suspect this won't go into force today. So I'm not sure how far they're going to get in terms of their readings, but my educated guess would be it wouldn't be enforced today.
Okay.
I've been mistaken, though, in the past.
Sure. and I suppose just an order of magnitude, if not today, it could be tomorrow, or is it a month from now? Just hard to tell. Okay, no, that's helpful. And then it seemed to me that in Section 6, we do retain the ability to have a bylaw that requires masking in city facilities. Is that correct?
Yes.
Okay, well, that's as far as I was able to get. But I'm also understanding that it's not, that this would apply retroactively to existing bylaws, so our current bylaw would be automatically repealed.
Yes, correct.
Thank you. I'll save questions for a bit later. I yield my time. Thank you.
Thank you, Councillor Stevenson. We are kids, treated like kids by the province. So it's really sad day. Councillor Rutherford.
Point of order, are we going for a break at 3:30?
We'll be on the recess for 15 minutes. All right, I would like to call this meeting back to order. I'll do a quick roll call. Councillor Wright,
I'm here. Good afternoon.
Councillor Knack,
Good afternoon.
Councillor Principe is here,
Hello.
Councillor Stevenson,
Good afternoon.
Councillor Paquette,
Hello.
Councillor Tang,
Good afternoon.
Councillor Hamilton,
Good afternoon.
Councillor Rutherford,
Good afternoon.
Councillor Salvador,
Good afternoon.
Councillor Cartmel,
Good afternoon.
Councillor Rice,
Good afternoon.
and Councillor Jans.
Good afternoon.
Thank you. I'll go to Councillor Rutherford next.
Great, thank you so much, Mr. Mayor. Just sort of picking up on the conversation, I have a question for admin. Did council direct you to do that survey? Was it a motion of council to do the survey?
It wasn't a motion of council. I think through the various bylaw, mask face covering bylaw discussions, there was a commitment that we would do engagement. And so this
Okay.
was a mechanism that we used that was available to us to be able to provide feedback to council related to perception, or not perception, feedback from Edmontonians, sorry.
And the survey is only one part of that insight gathering that we did.
Yes, yes, but I just want to be clear because, I think sometimes when we put these surveys out, the expectation is that the qualitative numbers will be the only thing that we factor in our decision-making. And that whatever happened previously with previous mask discussions that we weren't a part of, I was a bit surprised when I found out that survey was being shared with Edmontonians.
So I think my understanding is that through face covering bylaw discussions and COVID updates with this council,
Yeah.
our folks had an understanding that there would be some engagement related to that decision point.
Okay.
So under the circumstances, we used the best tools that were available to us to do some engagement.
Yeah.
In the week that was available.
I know, it was a tight turnaround for all of us. And I want to pick up on Councillor Paquette's sort of concerns because I know that survey was widely shared with some lobbying groups. And so do we have, was there a spot? I guess my question is there just qualitative analysis or do we have is there just quantitative analysis or do we have qualitative analysis as well too?
The nature of this kind of survey is that you end up with quantitative information.
And then sometimes with qualitative data, by qualitative, I mean quantitative, sorry. By quantitative data, marginalized voices can be erased because they're not the majority, correct?
I think that's a fair statement about the limitation of quantitative research.
Yeah. Yeah, if you don't do the qualitative in addition to augment and get the picture.
Which is why the conversations with the various stakeholder groups are valuable given that they give a qualitative perspective.
I didn't see any conversations with any of the advisory groups, though, like Accessibility Advisory or WAVE as part of that stakeholder. Did we talk to those advisory groups?
I'm going to ask Ms. Poirier to answer that because she had oversight of it all.
I'm just going to check the stakeholder engagement list to determine. I can't recall off the top of my head. I'll get back to you on that.
Okay. And no, that's fair. And then my next question is around one of the concerns that's come through my inbox a lot, and we've heard it from the business community that has emailed council, is around that inconsistency in the loss of business. But do we have any data that shows that in the last week that businesses have had a loss in revenue as a result of us continuing the mask bylaw? Do we have any data to go with that perception?
We don't have any analysis of their business, of how busy or not businesses have been in Edmonton.
Well, and revenue, if they've lost revenue. Or
Correct.
anything.
We don't have that.
Okay. And it would likely be a scenario too that while we lose some people to other surrounding municipalities, that there could be a demographic in other municipalities that appeal to come to Edmonton as a result of having a mask bylaw. Is that a fair statement?
I think people are going to exercise their choices in the way that makes sense for them. So you could have inward and outward flow.
Okay. And then my last question is to our legal advisor. In looking at Bill 4, it seems like we are still able to have the authority of, over health at the local level. Can you speak to that? Because that's another thing that's come through my inbox a lot, is that municipalities shouldn't be in the business of health. But in the MGA, it does speak to that, and Bill 4 doesn't rewrite that section.
That's correct, Councillor. So the section in the legislation is very broad, allows us to work in that space, health, wellness, well-being. This is a very narrow change to that legislation. So yes, the short answer is yes, you can continue to work in that space. This is a very narrow piece that forces you to look for approvals.
Great, thank you so much.
Thank you, Councillor Rutherford. Councillor Jans?
I'm wondering at this time whether we should adjourn the meeting because we have new information now coming forward with this bill that may have implications on this discussion. So I'm wondering and I'm just trying to think, if we were to do that, maybe this is a question for the clerk, would the business then be carried forward to a future meeting and we could have a deliberation and discussion then? Through you, Mr. Chair.
What would be the process? I don't know what would the process be for adjournment.
So if you are adjourning at the set time, which would be at 5 o'clock, and you still have items remaining on your agenda, then as per your bylaw, you're going to come back tomorrow. If your items are not completed by the scheduled time, you're going to continue on the next business day. So if you adjourn at 5 o'clock, which is your set time, and you still have 1 or 2 items left, then you're going to be coming back tomorrow morning at 9:30. I'm just trying to figure out, I believe the special council meeting will supersede the regular scheduled executive committee meeting for tomorrow. Or you can, by motion, give us direction for when you want to change your orders of the day today and continue this meeting at a time that is convenient for yourselves.
Right. I guess and I mean, I'm going blind because I've only just had a cursory glance at Bill 4, but when we came together last time to repeal the REP, one of the arguments around supporting the repeal of the REP was it would still remain optional, that businesses who wanted to do this had that choice. And one of the arguments I've heard from the public is saying the importance of choice, that businesses should still have a choice whether they want to have masks or not. The courts have ruled that they will continue to have masking. Others have, indicated choices either way. And I guess now, as I'm reading Bill 4, and I don't have time to analyze it, the removal of that choice piece seems to be quite concerning. And so this is hard when you're trying to make a decision here at council at this dais here, but then there's other pieces orbiting. So I'm wondering if it's maybe a motion to postpone this to a later date so we have time to analyze the legislation. So I'm not making that motion at the time, but I would just signal to my colleagues that the great discomfort of trying to make an educated and informed decision here, and that's really challenging. So, and it's not fair to administration to put them on the spot and try and get them to analyze. So I'm just going to mull this over a little more and cede my time back. But if I chime in again, I may try and contemplate another action.
Thank you, Councillor Jans. Councillor Wright?
Hi, thank you very much. My question, I guess, is directed at Ms. Owen. You talked about clarity for Edmontonians and aligning with the province's mask mandates. So it states that required on municipal and interprovincial public transit, AHS operated and contracted facilities and continuing care settings, but you may also be asked to wear a mask in some community health settings, such as pharmacies, physiotherapies, or doctor's office. So I've got a bit of a scenario, and I'm just wondering if you could tell me when I would need to wear a mask. So Let's say that I take an ETS bus to a yoga class over at the Meadows Rec Center, and then I take a taxi over to my doctor's office for an appointment, and after that I have to stop off at the pharmacy to fill up a prescription, and then I'm back home again. In the afternoon, I decide I'm going to stop in and visit the Laurel Retirement Residence. And then later in the evening, I take an Uber to go out for supper and then off to a hockey game. The next morning, I have to take a Red Arrow bus to Calgary for meetings. When do I need to wear a mask?
I'm not sure I followed every step of your journey, but I think you've illustrated a lot of putting on and taking off of masks in the current scenario that we're in.
Okay, well, this is more in line with the province of Alberta's masking requirements as to when I need to, when I don't need to. And I just think the more clarity is provided is that if you're in the city of Edmonton, you wear a mask. Isn't that more clear than putting it on and putting it off and trying to figure out who might want me to wear it and who might not?
I think that certainly within the boundaries of the city of Edmonton, it does. I would also flag Councillor Wright that an individual can make that choice. And an individual can choose that regardless of what the bylaw is or where the requirements are, if they feel more comfortable wearing a mask in any of those situations you've identified, there's nothing preventing them from doing that.
But if someone's more vulnerable or susceptible, immunocompromised, how can they feel confident going to any of these places, not knowing, where or when masks are going to be required to keep them safe and protect them?
Again, tough situation for us. We are not the public health authority, the province is, and the province has identified where and when. I understand and appreciate that it can get confusing. I think what we're hearing from business community and others is that it's confusing now in that the city of Edmonton is the only municipality with a masking bylaw in place. However, it's still an individual's choice if they feel more comfortable wearing a mask, and we have communications that would support this, that they are absolutely encouraged to do that.
But from the information that was provided, you're also hearing from the seniors and other organizations that want the mask mandate to stay in place. So I don't want to be pitting business against seniors, but I just, like I said, for clarity for Edmontonians, I would think it's clearer to have masks required across the city. That's all. Thank you.
One of the things that we would be intent on doing, Councillor, is ensuring that Edmontonians understand they have a choice, and that we would assist businesses in describing that choice to their patrons.
I guess my concern is not all people have the choice to feel safe when they go out.
Yeah.
Thank you.
Thank you, Councillor Wright. Councillor Tang.
Thank you for the presentation. I wanted to talk a little bit more about the slide with the maps, and that your research of all the provinces and their plans there. I'm curious, in that research, did you look at specific municipalities and what they're doing within it?
I'll just see if Ms. Poirier is on the line or someone on the task team is on the line. No, we didn't go down to the municipal level, and someone highlighted earlier that there's differences in terms of public health authorities.
Fair enough, and that varies from province to province. So for example, in Saskatchewan, I don't know if they give that public health authority to municipalities. I would be curious to know what Saskatchewan is doing, for example. Understandably, Toronto, that's written in their legislation. And I guess just kind of giving this, the data at this level isn't necessarily helpful for us as municipal government trying to make this decision. I think that's a gap. I also think it's just, in general, it's a gap that I've seen throughout the last 2 years when we don't have this kind of authority or data or decision-making power.
We provide what we can within the time that we have available and the resources that we have and the information that's available to us.
Oh, fair enough. I think most of my questions have been asked. So I'll just end there. Thank you.
Thank you, Councillor Tang. Councillor Rutherford, can you take the chair, please?
So taken.
Yeah. So once Bill 4 is becomes the law, the existing bylaw that we have in place will cease to exist, right?
Correct.
Okay. And with that, our ability to, if we want to keep masks mandatory on public transit, will also cease to exist.
In our own bylaw.
Yeah.
So the public transit is a part of the current provincial order. Is that what you're asking, Mr. Mayor?
I just want to understand that Bill 4 allows municipalities to have bylaw in place in facilities and services that we provide, like transit, recreational facilities. Now we require bylaw on transit. I just want to understand what happens if we repeal the existing bylaw, and then how we enforce if we want to a mask bylaw on transit.
We could pass a new bylaw. So if our bylaw is repealed, we could pass a new bylaw within our authority to keep masking on transit.
Or could we amend the existing bylaw to keep it implementable or effective for transit only? Because I understand in your presentation, there's a high level of compliance and very little confrontation on with passengers and drivers. Am I right in that assessment? What you said?
Yes, high level of compliance. We also have heard from transit users support for wearing masks on transit, and our Edmonton Transit Advisory Board encourages that mask use continue on transit as well.
Okay. What would your advice be for other facilities, city-owned facilities?
Based on the multiple factors that we've identified in terms of our advice today related to repealing the mask bylaw, understanding it's been complicated by Bill 4, our advice would be transit only.
Okay, you would not recommend in rec facilities or Valley Zoo or other facilities?
That's correct, and I believe, and I'll just wait to confirm from the folks here, that EPL is in the same position in terms of thinking. I'm just waiting to see if they're going to chat me and let me know that their thinking is the same.
And they will make it voluntary.
Correct,
Okay.
correct, and that, they've just confirmed that based on our engagement with EPL.
Oh, I see, okay. And just a clarity on Councillor Knack's earlier question about a bylaw being reviewed by the minister and the province, that would have to be a new bylaw, right? Can't be, if the existing bylaw would not exist no longer once the legislation is proclaimed. So it has to be a new bylaw, brought forward, debated, passed, then sent to the minister for approval or review. We got it. I just wanted to make sure that we were clear on that. What other tools do we have to protect the most vulnerable Edmontonians who are immune compromised? They don't have access to vaccine. They can't get vaccinated, and the kids who are not eligible for vaccination. Like, what other tools do we have? This thing works. This thing works to protect me and protect my colleagues and others, right? So if this thing is gone, do we have other tools that we can look at that will give some protection to the most vulnerable Edmontonians?
Well, it's the advice from the Public Health Authority, which is continue physical distancing, hand
Yeah, okay.
hygiene,
Yeah.
sanitation methods to ensure that we're minimizing the risk of spread.
And perhaps the most important of all, staying home if you're symptomatic with any kind of illness.
Yeah, which again leads to isolation, exclusion, and these are the most vulnerable people who are already feel excluded from the society, right? So I'm trying to figure that out. If province is going to force us to repeal this, right, what other tools do we have to give some comfort to the most vulnerable towards we have a responsibility?
Actually, I think one of our most powerful tools is one we've deployed throughout this pandemic, which is appealing to Edmontonians to be kind to one another and to support one another's choices. And if a person is making a choice to wear a mask, that they should not be in any way vilified or made to feel excluded. And that would be the focus of our post-council decision, whatever it may be, communications campaign.
Okay, good. All right, I'm out of time, and I'll take the chair back, and I'll go to Councillor Rice. She hasn't had a first round yet. Councillor Rice?
Thank you, Ms. Chair. I do have a few questions, and based on lots of emails in my inbox, also so many phone calls, and plus myself personally visit some local business and spoke to business owners. So my question is about, I really appreciate our city administration advice, and based on our city COVID-19 principles is follow the advice and guidance of the Chief Medical Officer of Health for Alberta. So if like our advice, we follow the advice and guidance from Chief Medical Officer, and Chief Medical Officer actually has access to all the medical data and across Alberta. So in that logical, if we don't follow this, and this get questioned so much, what else, what type of else data we talk about we can follow? I think this is something is really makes me feel unlogical. So my background is mathematics, I'm thinking logically. So if we follow that, and we advisor and then Chief Medical Officer has all the access to our medical data, and then that means their advice and guidance, and then that is our basic principle we follow.
And that has formed the basis of our advice that to go against the Chief Medical Officer of Health, the city would find itself in a position where it was difficult to defend that decision.
Thank you, and so that is, I understand why the basic advice and to remove mask bylaw and from administration. So that is my first question. And the second question, if you look at regional consistency, and I believe other regional, other municipalities, they're following the same principle, and for the advice and guidance from our chief medical officers as well. And so I believe that is the same principles they're following as well.
That is what we understand.
From research perspective, I heard my colleague councillors ask quantitative and qualitative data. I think from that perspective, we already have all the quantitative data and public available. And then we also have this qualitative advice and guidance and from Chief Medical Officer. If we have both, and then, so what else we could do or not follow this?
This is where subjectivity enters into the debate considerably. As we have conferred with various groups, there have been differences of opinion expressed, making it very challenging for you as governors to find the through line for your own decision making.
So if from historically, and if you look at most biggest decision making, I believe the principle and here and for the advice provided by administration is well followed, and then quantitative data and qualitative data, and in both sides, and then from like my understanding, I cannot find any other way and how to respond to this challenge topic for make a decision. And I understand, and this is a mixed viewpoint on the topic. And then I do care about public safety for our vulnerable population as well. I believe everybody care about that as well here. And then like Mayor Sohi asked the question, and how we address some concerns for our vulnerable population, and then how we protect their address their voice, listen to their voice, and protect their safety and for the health as well. And is there any other tool besides what we already mentioned, physical distance and hand raising or any other sense?
I think what we've learned in 2 years is that modifying our behaviors to think about the greater good is very important. And as I mentioned, we will be really focusing on reminding Edmontonians that regardless of rules, bylaws, regulations, that what we need to be is a community of tolerant, thoughtful neighbors.
Thank you. My time is out.
Yeah, Councillor Rice, can you move the third round, please?
I move the third one.
Second.
Second by Councillor Stevenson.
Don't need a seconder, I don't.
Yeah, we do. First, third round, we do. I'm learning the rules, Councillor. Paquette, you tried to trick me earlier on. Yeah. All right. Okay. Any questions? Seeing none, please vote. Yes.
I'm a yes, Madam Chair, or Madam Clerk.
We have all of the votes.
Display the votes, please. That is carried. Okay, now I'll get the list back. I think was Councillor Knack? No, Councillor Salvador.
Thank you, Mr. Mayor. So I'm just, again, trying to pour over Bill 4 as well. And just to administration, what does this mean for our ability to be flexible and adaptable in the face of a ever-evolving situation? I know being able to respond to that local context has been important for the last 2 years. I guess, does this limit that flexibility? It feels like absolutely yes, but I'm just trying to read it all right now.
Yes, I would say it does limit your flexibility to move in this space, if that's what you're asking.
Okay, yeah, and I guess just picking up where Mayor Sohi was going around transit and city facilities, we do still have the ability to have a bylaw in place specifically for those spaces, correct?
We currently do, yes. Once
Okay.
if this legislation passes, we will no longer have that bylaw.
Right, but we would have the ability to introduce a new bylaw specifically for public transit and city facilities, correct?
Correct, Councillor.
Okay. What would administration need in terms of direction in order to look at that and to prepare that?
We would need a very clear motion on that point.
Why can't we amend the existing bylaw? I thought you said we could amend.
I thought we could amend, yeah.
I think we'd still need that direction, a motion
Yeah,
to amend.
of course, but we could.
Yes.
We don't have to enter a new one. We could amend the existing one, right?
Yeah, the amending bylaw is like a new bylaw.
Okay, got it. Okay, sorry, Councillor Salvador. I just
No,
want to make.
that's great. That
Right.
provides clarity too. Okay, well, I definitely am interested in that. Okay, and then I'm sorry, but this is to legal. I'm just trying to walk myself through this process. If our mask bylaw was to stay in place as of today, I guess is that repeal automatic, or is there a process that the province would have to go through in order to repeal that? Or like what do those steps look like?
Yeah, so it would be automatic. So if they pass their legislation, our bylaw would be repealed automatically.
Okay. All right. And then just to switch gears really quickly, I'm also quite concerned about what this means for folks who are, transplant recipients, cancer patients, immunocompromised folks, people living with disabilities in our city. And those are the types of people where when we say we have to learn to live with COVID, that's not really a viable option for some folks. So what was the engagement? Did we get an answer to that around how we engaged with some of those more vulnerable folks in our city specifically?
Ms. Poirier, could you weigh in on that, please?
So we did engage with a number of different communities, and I can respond that we did indeed engage with a number of council's committees, and we did get responses back from 3. However, they did not feel it was their position to provide specific direction to council. As it relates to our more vulnerable populations, we did engage with our vulnerable stakeholders who are many of our shelter operators, and we received a number of different responses from them. Some of them were more, while they would all like to see the face covering bylaw continue, regardless of the decision of council, they will keep it in place as much as possible within their own facilities, making their decisions as it relates to the safety of their employees, as well as those who are participating in those facilities.
Okay, thank you for that answer. And just to Ms. Owen, were we able to get that more granular location-based data for the surveys as well?
Yeah, we haven't had a chance to do a detailed analysis, but our sense is that if we looked exclusively at just the Edmonton Insight community data, not data from Edmonton, but the Edmonton Insight community, which, as you know, is a particular demographic, it would tell us a different story that is closer to a community split on the issue.
Okay, so yeah, recognizing that set of data shows a more 50-50 type split. That's correct?
That's correct.
Okay. All right, that's my time. Thank you.
Thank you, Councillor Salvador. Councillor Knack.
Thank you, Mr. Mayor. First, just a quick question to Ms. Owen. In a response a bit earlier to one of Councillor Rice's comments, I think it was suggested that we're going against the advice of the Chief Medical Officer of Health, and I just want to be clear, we haven't actually received the advice, correct? Nobody has that advice at this stage.
Only as it's rolled up into government announcements. That's correct.
Yeah, because I think it was even just in the last 20 minutes, she was asked a question about what she would provide advice to Edmonton on. And I think she was quoted as saying, masking is a prudent public health measure. She also goes on to say, though, to be fair, that the policy rules around masking are difficult ones and have to be weighed using advantages and disadvantages. And then ultimately should be made by policymakers. But I just wanted to make sure there actually hasn't been formal advice from the Chief Medical Officer of Health advising us in either way. The closest we have is that there's a statement that it's a prudent public health measure.
I would just underscore that the orders to repeal masking bylaws, masking rules provincially were signed by the Chief Medical Officer of Health.
Absolutely. Yeah, no, that's a very fair point. Thank you. Mr. Mayor, I'm struggling on the process piece because technically these aren't cross-referenced right now. And so if we wanted to create a bylaw that would be submitted for review, and maybe this is to the clerks, and I know that they've spent a little time thinking about this, it feels like that would be in order for 3.1. And then 4.1 is separate because that could be a repeal motion. But independent of that, we may want to create a bylaw, at least I'm interested in that would be submitted for review of the Municipal Affairs Minister and Chief Medical Officer of Health. So I'm just wondering what the right way and order to do those things are.
Oh, that is absolutely, Madam Clerk will have to give us guidance on that. I have no idea.
It's interesting. So what's before you right now is a verbal report from administration. The next item you have before you is a repealing bylaw. And am I understanding correctly that it's possible, whether a decision's been made on 3-1 or 4-1, we might council might consider putting a motion on the floor for us to craft a different bylaw?
Yes, I think independent, I would like to have a draft bylaw created and submitted for review as outlined as in Bill 4. And I would want that regardless of our decision on 4.1 to repeal or not, because I don't think that affects that. But I just don't know when to do that, if that should be done subsequent to our debate on 4.1, or if that is essentially a replacement motion for 3.1, because we could do that before a repeal or not. I don't think that would be out of order.
No, I think there is no motion on the floor right now regarding 3.1. So if that's something that council wants to entertain, that would be up to the chair to accept that, but I can't think of a reason why that wouldn't be in order.
Okay.
So that would be a new bylaw put forward, approved, then goes to the province for review.
So step one, so the bylaw doesn't exist.
Yeah.
So step one would be for council to direct us to create a bylaw with enough specificity that the city solicitor would be able to create that. So that would be a motion that would then need to be passed. And then I'm not sure how quickly something like that could be turned around. So we'd probably need to take a few moments to consult with administration.
Mr. Mayor, why don't I see there's some additional speakers.
Yeah.
Why don't I take some time to make sure we have a clear wording? We'll work with folks and come back to make that motion for 3.1.
Okay, thank you. Councillor Stevenson.
Yes, thank you. Just following up on the Insight Community subsections, I know you shared some stats verbally around breakdown around gender. Do we have a breakdown around people with children in the home?
Don't believe that's one of the demographic questions, but we will check right away and I'll have an answer for you shortly.
Thank you. I'm just curious in terms of what informs administration's recommendation to not have the masking in recreation centers where children who aren't able to get vaccinated may be more likely to attend with their families.
I think part of it is, again, not one consideration, but multiple considerations, one of them being what I referenced related to consistency, and Mr. Jevney mentioned this sort of out of town into Edmonton, and then just sort of that challenge that gets created for our staff related to enforcement and being in that situation. So
okay, but not directly based on user feedback in terms of what folks using those facilities are wanting.
I'll just check in with the team here to see if that was a specific. I don't believe it was. I think it was more related to the general questions that Catherine alluded to, which is more broad in terms of the question.
Okay.
Councillor, the masks are only enforced in rec centers when they're in common areas. Of course, once they're participating in any activity, the masks are taken off to allow them to participate. Great. So the majority of the time they're visiting, they don't have a mask on.
And there is an answer to your question about the demographic breakdown about households with children. We don't ask that.
Okay, thank you. At the risk, and I recognize, I think there are some other bylaw discussions that are ongoing, but I've been trying to think of alternative approaches that we can take, particularly in light of Bill 4, and if we were to pass a subsequent bylaw that was then not successful through the Bill 4 review process. Again, we talked a lot today about choice and providing people with options, and for me, I think there's space for sort of a formal voluntary opt-in option for businesses in Edmonton. So this would be, again, an option that businesses could elect to be involved with. It would include being listed on the city's website, which would also enable residents to have the choice to choose which businesses they attend if they want to be in a space where masking is asked for. So just wondering if administration could speak to that in terms of an option. Again, not putting this forward as a formal motion at this point, but just curious in your thoughts on that.
Certainly businesses who declare that they are businesses that would like their patrons to wear masks, we think that's a perfectly legitimate choice for those businesses to make. We think it's a more legitimate task for Chamber of Commerce, BIAs, or the Downtown Business Association to keep that registry that you describe.
And why is that, sorry?
Because we think it puts us in the position of seeming to favor or it puts us in the position of seeming to favor some businesses over others, which is a position that would feel uncomfortable for the administration.
Mm-hmm. Well, I guess just to the earlier question around protecting our most vulnerable and what options we have to support them, could we not see that registry as in that light, that it's providing our most vulnerable citizens with the information that they need to make choices that keep them safe?
Once again, our feeling is that it begins to create a dynamic of divisiveness, potentially, of businesses who are making one choice over another.
But you've said earlier that businesses can make those choices themselves.
That's correct, but we don't believe that it's the city's place to weigh in on those choices, but to support them with communications materials. By holding a registry, we believe that takes us into a more adjudicatory position.
And in terms of some of that communication support, so the city would be providing materials to those businesses, which you wouldn't consider to be preferential treatment for them?
Absolutely not. We would be giving a suite of materials to help businesses with this transition, including posters should they wish to indicate that masks are no longer needed, and materials for businesses who are choosing to keep masking in their establishments. So we would be agnostic on the content, just making sure that people had what was available to support them.
Thank you. My time is up.
Thank you, Councillor Stevenson. Councillor Wright.
Hi, thank you very much. And thank you, Councillor Knack, for clarifying that about the having access to the medical information of our Chief Medical Officer. I just also want to clarify on that Bill 4 where it says it's the minister that will consider the public interest, and that in this case is the municipal affairs minister. It's not the health minister.
Yes, that's correct.
Okay. And then are you aware of, Ms. Plouffe, of any other provincial governments that are considering amending their legislation to restrict municipalities in their provinces from being able to maintain these types of protections?
No, I'm not aware of any other provinces that are doing that.
Okay. Thank you.
Thank you, Councillor Wright. Councillor Rice.
Thank you, Mr. Chair. I would like to go back my previous question, and I think this is a very important topic and decision and for council to make today. And so if we have the advice and guidance and from Chief Medical Officer, and if we are not follow up, and based on all those public engagements, the voice we heard, what's the potential risk for us?
At the risk of being repetitive, I think the greatest risk is inconsistency, confusion, potential divisiveness. I think if this last 2 years has taught us anything, It's that we need to be as unified as possible, not divided. And positional rules and regulations at this stage appear to be dividing folks as opposed to uniting them.
Thank you very much. I think that answer will be many Edmontonians expect to heard. Another question is about, this is actually really a frustrating time. If we have upcoming bylaw for discussion, we have other bylaws in front of us, and then, Mr. Chair, is it time for us to end this discussion right now for this 3.1 item? And it will allow us to have time to discuss other options and bylaws. And then, so if it's allowed from procedure perspective, I would like to move the report provided by administration be received for information.
You are welcome to move that motion, right, Madam Clerk? It will be moved for information, received for information. Somebody would have to second that, and then, but we will have to carry on with the questions until we exhaust with the list, or somebody call to question to end the debate, right? So
I'll second.
second it. Okay, so we do have a motion on the floor to receive 3.1 for information. Okay, all right, so that's on the floor now. And are you done, Councillor Rice?
So I just want to quickly speak to this motion on the floor, and then.
So if then, I'll come back to you later on to speak to this.
Okay, sure.
Yeah, once we are concluded with questions.
Sure.
Okay, thank you.
Okay.
Councillor Knack?
Thank you, Mr. I was just going to check to see, we had a draft motion, but I think I can make it subsequent to this item, to receiving for information. So I just want to confirm with the clerks that there would still be in order to make the motion that we've been working on subsequent to receipt of information.
Yes, that's correct.
Okay.
Thank you. Then I'll have to support this and do a subsequent right after. Thank you.
Thank you. And Councillor Tang?
I'll be quick, just to clarify. Let's say the mask bylaw is kept. Sorry, this will be for Ms. Plouffe. And the bill 4 repeals it. And something else comes up, we can still introduce another form of bylaw. But who is to say that bill 4 might not be amended to challenge that?
This really gets into a timing piece. So only if the legislation is passed, then our ability to keep our bylaw or put new bylaws in this space, that's when our challenge will come. But currently, we don't know what's going to happen with legislation. I understand they've canceled their evening sitting, so this will not happen today.
Right.
Am I answering your question, Councillor?
Yeah, I guess I just want to make sure that, just in terms of making sure that we still, well, no, it is clear. I just want to clarify. Thank you.
Councillor Tang, there are lines within the bill that do provide an opportunity to address some of the items that have come up today. Obviously, it's on the fly. But to your question, could the province change it?
Speculation.
Yeah.
Yeah, no, fair. Thank you.
Thank you, Councillor. I'm really wary of the time. We have 20 minutes before we end the meeting, and we have one more item to deal with, so and possible subsequent motions. So, Councillor Paquette.
Yeah, thank you, Mr. Mayor. I'll be very quick. So first of all, why did we bring a mask mandate in the first place? Because I remember way back when it was all about personal responsibility, but that wasn't working. And so the province said, hey, municipalities, if you want to put a mask bylaw in, you can. Is that, I mean, that's pretty much where it was, wasn't it?
Yes, being front and center on that, yes, that's exactly what it was.
So here we are. Now we're talking again about, oh, personal choice. What makes you feel comfortable? What do you want to do? Meanwhile, we are literally still within the grip of COVID, and we know a new variant is coming forward. So I'm just confused by this verbiage when we already know through experience that if there is no mandate, that does not enhance our public health. That's why we had mask mandates, yes?
I think the very distinguishing feature is that we are 2 years in with a vaccinated, not fully because of all of the exceptions, but with a vaccinated population. So the conditions have changed.
And that's a great start, except that our hospitals are overwhelmed with, we just cannot catch up provincially to the overwhelm in hospitals. People are waiting for surgeries, for life-saving surgeries that they cannot get access to. This is very serious. And it's being treated like a political football, and it's been treated like that since 2020. So my question then is, with all of that in mind, what it comes down to is that people are talking about lifting this mask bylaw, and correct me if I'm wrong, but because frontline services, when it comes to businesses, frontline services, those people are being subjected to abuse, verbally and sometimes physically. And because of the bad actions of a few, we're talking about lifting life-saving interventions. Is that, that's really the gist of it, isn't it? When we say, oh, people are tired, oh, they don't want to mask up, oh, the pandemic's still here. But the fact is, we are bending to the will of people who are literally scaring other people. Am I off on this?
Happy to answer the question in there. I'm just, I can't find it.
Yeah.
Yes,
that's okay. You know what? I'll leave it at that, Mr. Mayor. And I'm really excited about Councillor Knack's motion. I want to see what it actually contains, and I'm ready to go.
All right, thank you. So what I would suggest that we vote on this, and if council members want to speak about something, I'm pretty sure there's a number of council members who want to speak, that we reserve that for our 4.1 item, right? And that we vote on to receive this for information, whichever we want to do that. So I will go to Councillor Rice to close on this. Councillor Rice. And this is to receive for information. If you want to speak to the broader bylaw, you will have an opportunity to do so on 4.1.
Okay. Thank you, Mr. Chair. I would be happy to speak this motion. And then, so during this long debate, I do believe our city council needs to move on and to make decision. And otherwise, we stuck here and cannot make any decisions. And also, I want to take this opportunity to thank all the our Edmontonians who reach out to our councillor's office to participate in our city's surveys. And also, I want to appreciate the efforts, great efforts of city administration put on to follow the basic principle that nearby municipal followed, and then try to keep the benefit and for Edmontonians, and also try to avoid the big risks and for our Edmontonians as well. And then by that say, I will leave the time and for the following discussion, and then encourage our colleagues and to vote and for March 8, 2022 Office of City Manager verbal report be received for information.
Thank you, Councillor Wright. So this was, we have a motion on the floor. Please call the vote. I'll call the vote. Yes. I don't know why my system, there you go. I got it back.
Councillor Salvador?
Yes.
We have all the votes.
Display the votes, please. Thank you. That is carried. we are going to go to 4.1. Councillor Nack, I'll come back to you for a subsequent after we're done with 4.1. Is that okay? Yeah.
Sure. Yeah. I mean, the order might matter a little bit, but I'm okay with waiting.
Yeah. Okay. Would someone care to move the recommendation or 4.1 so we can debate and deal with it?
So just for clarity, there's no recommendation.
There's no
but
recommendation.
there's a
Somebody would have to
repealing-
move the repeal of the bylaw if we want to debate that.
If you want to talk about it, you might want to put first reading on the floor.
Mayor Sohi, I'll move first reading of the bylaw.
Thank you, Councillor Cartmel. We need a seconder.
Second.
Councillor Rice seconded. So we have a bylaw 20061 on the floor now, right? With the first reading moved. So, Madam Clerk, quickly, do we vote on first reading before we go to questions and debate, or we can go to debate now and questions?
You can vote, or you can discuss. It's totally up to yourselves.
All right, are people on the list to debate this, or we can give first reading, then debate? Okay, Councillor Nack.
Thank you. I'm ready to speak just to this, if that's okay.
Yes, absolutely. I think we are enough debate. We all know where our minds are on this. So,
while I don't love the order of this, I would have preferred to have done the subsequent. In interest of efficiency, I was okay with doing this first. Noting that I will be putting forward a subsequent, which asks for the creation of a new bylaw that can then be submitted to the provincial government for review. And I'll speak to that when I introduce that motion. But I just want to make sure the reason I will be supporting this is because it's going to get repealed anyways. And I'd rather start fresh on the new bylaw and submit that for the review, and I'll explain my reasons for that at the appropriate time. But just in case there's any confusion as to why I would support this, noting that I'll be putting forward another motion is purely because this bylaw gets repealed upon the passage of Bill 4. And therefore, there's no sense in trying to hang on to this one when we can go and do this other body of work. So just so there's no confusion as to why I will support the repeal of this, with a very clear expectation another motion is coming forward that would then engage, I think, the folks who need to engage. Thank you.
thank you, Councillor Nack. Councillor Principe?
Just a question of clarification. We are voting on this bylaw now for the first reading, is that correct?
We will be, yeah.
And this bylaw is to rescind or repeal
Yeah.
the mask mandate, correct?
Yep.
Can I just speak to it now?
Yes,
Is that
you
okay?
can.
Yeah. So I would like to say that I am going to follow what Dr. Sikora said. He is a public health doctor with specialized education and schooling. And he stated that it is a reasonable measure to remove the mask bylaw at this point. And even if I had all of the information that the chief medical officer has, I do not have the expertise or the education to interpret that information. So I will have to go with what I believe she signed the paper. So I will have to follow those guidelines. Thank you.
Thank you, Councillor Principe. And anyone else to speak? Councillor Salvador.
Sure, thank you, Mayor Sohi. Yeah, so just I'll start by saying that I do firmly believe that masking is one of the easiest and simplest things we can do to protect community members, and that we have dropped our guard several times and subsequent waves have followed. We've not achieved the stated thresholds in our bylaw, and in my opinion, we haven't been provided a compelling reason to ignore those thresholds. We've been told that testing is less relevant due to low testing, but yet we're still exceeding those metrics. The province has been unwilling to share data, as we've heard throughout the conversation. And right now, I mean, I'm looking at a bill that would essentially limit our ability to take steps to protect Edmontonians while we're still in a pandemic, while there are variants on the horizon, while hospitalizations and wastewater data are high and our critical care units are at capacity. As was mentioned, COVID doesn't stop simply because we set a date or because we're tired of our protective measures. We have to be able to have the ability to have a fluid conversation as the situation evolves, and I'm deeply disappointed that the province has taken this step. Ultimately, I do want to be able to make a decision that is in line with science and in line with data. But given the difficult situation we've placed in, I would much rather take a precautionary approach, given the experience we've gained over the last 2 years and given the unpredictable nature of the virus. I do just want to take a second to recognize that there are folks out there who can't simply learn to live with COVID. Like I mentioned, there are transplant recipients, cancer patients, immunocompromised Edmontonians, people with disabilities, and so many more who don't have that ability. And I worry that repealing this bylaw would leave many Edmontonians behind. I think that our decision-making also lacks the ability to take into consideration some of those longer-term effects, long COVID, and what that might mean for our society. Now, absolutely, I understand that after 2 years of the province proclaiming that they would respect the authority and decisions of municipalities, they have rather abruptly changed tack. And Bill 4 may mean that our bylaw is repealed, and it may remove our ability to put these types of bylaws in place. But that has not passed in the legislature as of yet, and at present, under our legislative authority, it is our decision to make. So I will not be supporting repealing the bylaw, but I really appreciate the conversation today and appreciate the work that administration has put into this. Thanks very much.
Thank you, Councillor Salvador. Councillor Stevenson.
Thank you, Mr. Mayor. You know, I've heard today that our Chief Medical Officer has said that masks are a prudent health measure, that our ICUs are still over capacity, and we haven't caught up on the backlog of critical surgeries. I know that retaining the bylaw has impacts for many businesses and frontline staff, and those impacts are real and they're difficult, and I wish that no one had to experience them. But rescinding the bylaw also has impacts, and particularly on those who are most vulnerable. So I recognize that by voting against this bylaw today, you know, weeks or months from now, I may look back and say, hey, that was a mistake. That was too conservative. I was being overly cautious. But I'd much rather err on the side of caution, of protecting our community. And so I will be voting against the bylaw to rescind. Thank you.
Thank you, Councillor Stevenson. Councillor Wright.
Thank you very much. In the absence of medical data that we've requested from the province, I'm left only to hear from the advice and recommendations of the greater medical community. And over the past week, the Public Health Agency of Canada states that our best advantage going forward will be to maintain vigilance, properly wearing well-fitted and well-constructed face masks. Dr. Teresa Tam, Canada's top doctor, says that ongoing easing of public health measures could lead to increased transmission in more areas over the coming weeks. And in our own city, many doctors have reached out to us and have spoken out in favor of maintaining the mask bylaw, at least for now. Dr. Darren Markland notes that our provincial government is willfully accepting the known poor outcome of COVID infections amongst our immunosuppressed. We're effectively sacrificing them for the general public's convenience. And Dr. Shazma Mathani, on behalf of many in the medical community, raises concerns that by lifting the mask mandates, we're increasing the exposure of those already most at risk and least able to protect themselves, those who are elderly or immunocompromised or who have children too young to be vaccinated and still have to interact with the public. And by removing the mask mandates, their risk profile is significantly increased. Now, during the election, and from what I continue to hear from residents, is that Edmontonians, for the most part, are caring and compassionate, and they want to keep their neighbors and loved ones safe. And I've spoken directly to healthcare workers that are concerned about the community spread and the risks that brings into their facilities and centers that they work in. And from this afternoon, even Dr. Sikora expressed his worries that our healthcare system and the frontline workers, including the doctors, the nurses, the healthcare aides, that they've been the ones that have bared the impact of the decisions made by our non-medical experts in the provincial government. One of the many emails that I received from constituents and others this past week, I think sums it up nicely. He said that a mask is a minor inconvenience that protects myself and others. It protects the most vulnerable and the immunocompromised, and they deserve to be able to go places without being in fear of contracting the virus. And so it's for these reasons that I will not support the motion to repeal the current bylaw that we have in place. And I look forward to Councillor Knack's motion going forward. Thank you.
Thank you, Councillor Wright. Councillor Paquette?
Yeah, thank you, Mr. Mayor. I'm going to support the motion from Councillor Knack, and the reason is that we're backed up into a policy dead end here. It really doesn't matter what our, our decision is at this point, because the province can rescind the authority of the bylaw later tonight if they wanted to. It really doesn't matter. What we do have in our control at this point is the subsequent that's coming, that we can apply to the province to approve a new bylaw. And in that approval process, you know, we will have done our due diligence. And that's frankly the extent of our powers now. So whether you want to hold on for another few hours or you just want to get moving forward with the approach that's going to be proposed by Councillor Knack, the outcome actually is going to be about the same. So while we do have this in our control to make a decision, I'm going to make a decision to repeal and submit a new application to the province. So thank you, Mr. Mayor. Of course, this is not anything that anywhere that any of us want it to be. We'd rather put science ahead of politics, but that is not to be, apparently. Thank you.
Thank you, Councillor Paquette. Before I go to Councillor Tang and Councillor Rutherford, I would request and direct to clerk about it that we can extend the order of the day till 5:30 to see if we can finish these items. Is people okay with that?
So moved.
Moved by Councillor Knack. Can someone second by Councillor Rice? Any questions? Seeing none, please vote to extend till 5:30.
Just give us a second. We're pulling up the vote now. Councillor Rice and Councillor Jan. Oh, there we go. Councillor Rice? Yes. We have all the votes.
Display the vote, please. That is carried. Okay, I'll go back to the list. Was Councillor Tang, you were next up, right?
Thank you, Mr. Mayor. You know, I am looking forward to Councillor Knack's motion. What we have in front of us, you know, as much as many, like all of us here want to do what is best for the most vulnerable for our community, I think I'm fully aware that this decision is a political one. And I'm actually reminded of my education here at U of A in School of Public Health. There was actually a very clear diagram that when we make public health decisions, evidence and science is part of it, but so is public input, and so are circumstances. And in this case, I think we have a very challenging circumstance on our hands that is really for, you know, political gain than what is actually best for the community. You know, as much as we've done our insight survey and we've gotten some quantitative data, I also want to share that when the last time we were here talking about COVID measures, and we were looking at the local REP program, and at that time, my office actually sent out a qualitative survey to the folks in the ward, and it got a ton of feedback about the stories, about people's reflection, and each one was complex, each one was thoughtful, extremely different backgrounds and extremely different considerations. A lot of people, especially those from immunocompromised, are looking to the city for protection. But at the time, though, you know, we didn't have this issue of the potential being challenged by our provincial government. who are, in fact, through this decision, goading us into that division, which is something I heard overwhelmingly in the responses, that people are tired. People are tired of the polarization and the politicization of this public health decision. Sure, not all of us are public, medical experts, but as we've also heard from Dr. Sikora's comments, that decision-making in public health, it is for the elected officials, because we have so many considerations to make, and then many factors goes into these decisions in the best interest of population. So I don't like to be co-opted into these decisions, but I'm also being mindful of the circumstance that we are in, and to many of my other colleagues' comments, we need to focus on what is within our control. And I think one of the things that has become increasingly clear to me through the last 2 years, in fact, is the need for municipalities to bear that public health responsibility. I don't have that legal expertise to rewrite the Public Health Act, but I think that's something I hope communities are looking at, because it will give us authority that, cities like Toronto might have that we don't. And so for those reasons, I will be supporting, I'm looking forward to seeing and supporting Councillor Knack's measure about what is possible, because I don't think it makes sense for us to keep something in place that's only going to be automatically repealed, that will have even wider implications, not only for City of Edmonton, but for other municipalities across the province.
Thank you, Councillor Tang. Councillor Rutherford?
Thank you, Mr. Mayor. So I'll keep this brief for the sake of time, but I just want to reiterate that today my vote reflects a public health decision. I hear my colleagues in terms of being backed into a corner, and politically, if I was making a political decision, I would vote to repeal the mask bylaw. But I am really here to make a decision based on integrity, courage, and public health. And so as long as that is within my authority, similar to what Councillor Salvador said, I will vote that way. And I know many say, well, what's the impact, or what's the value of that? To me, it's also the message we send to those that are vulnerable, that are asking for somebody to stand up for them. So whether this bylaw passes or fails at this point is inconsequential. I want them to know that I stand with them, and I'm here with them, and I won't back down to political pressure. Thank you.
Thank you, Councillor Rutherford. Councillor Rice?
Thank you, Ms. Chair. I really want to speak to this motion, and then maybe I'm myself and a little bit emotional as well. I never consider myself as a politician, and even though, and then my daughter keep telling me, you are. And then this is not a political decision. And it actually is a decision from every council's heart, and to make the best decision and for our majority of our Edmontonians. And it's a hard decision because we heard different voice. But I want to say, I do believe our city should stay with its jurisdiction boundaries. And this is the voice over and over we heard from our Edmontonians. And then our Edmontonian pay the tax to our city government. And what is our accountability? What is our key services? We need to focus on our efforts, our time, and then to focus on our city's municipal responsibilities. And this is something I would like to say first. And also, I believe many governments in many parts of the province are transitioning away from COVID-19 restrictions. The society no choice but to learn to live with COVID-19, just as we have learned to live with other respiratory viruses such as the common cold and flu. So the government of Alberta has a provincial-wide public health department that has access to the best data. We talk to the all the time, and also health expertise in our province. The city Edmonton can benefit from following the public health guidance provided by our city and provincial chief medical officer. Well, I have heard mixed views from constituents in my ward. So the large majority of residents who contact me have asked that the city mask bylaw be lifted. Some people feel masks may still be beneficial for a little while longer. Others believe the mental health and the development of their young children is suffering as a result of mask mandates. So I have specific residents send an email to me and talk about her grandchildren's. Many residents in my ward have told me they want the same rules between Edmonton and the surrounding areas, as having different mask rules in different parts of our province can be confusing. Looking at the results and from our city administration provided today and the principles, the research on quantitative and qualitative data, after I consider all the information in front of me, so I'm going to support this bylaw to repeal the city existing bylaw. Thank you.
Thank you, Councillor Rice, and I see no one else, so before I go to Councillor Cartmel to close, Councillor Rutherford, would you please take the chair, please?
So taken.
You know, we all have a role to play in ensuring that we do everything we can to help protect each other and keep each other safe. And we played that role for 2 years, and we've done our part. But today I'm so disheartened that our provincial government is taking that ability away from us. But let me be clear, the provincial government encouraged and expected municipalities to implement mask bylaws when they lacked the courage to implement on their own. And for the past 2 years, Edmonton has its own bylaw in place, and it worked well. It helped control the spread. It protected the most vulnerable Edmontonians. And never once we heard from the province. They never questioned the existence of that bylaw at that time or the need of that bylaw. Were they questioning it now? And makes me wonder why. The same government that asked us to step up is asking us to step aside now, forcing us to remove these protections. And that is very, very disappointing. But that is the reality that we're facing. Government's ability to make changes to the Municipal Government Act to restrict our ability to protect our own Edmontonians speaks to the broken system of municipal-provincial relationship that exists in our province, and that needs to change. And I hope that as we move forward on building or strengthening our relationship, that we look at that. I want to keep a mask bylaw. I want to see our ability to protect our vulnerable people. But that ability doesn't exist now. So not repealing it and keeping it will be more of a performative act, not a substantive act to actually protect people, because we won't have that ability. So our hands are tied. That's what it is. Our hands are tied by this province that expected us to do the work they failed to do for 2 years. Now they don't want us to do that, right? So I look forward to Councillor Knack's motion to see if there's a way for us to bring something back that we can actually continue to do so, right? So at this time, we don't have that ability. So regretfully, we have to repeal this bylaw, even though we made our wish to do so. But that's the reality that we're facing. And I will take the chair back, Councillor Rutherford. And I'll ask Councillor Cartmel if he has any closing remarks.
Yeah, thank you, Mayor Sohi, and just a couple. And so I'll start off by saying that it's unfortunate and unexpected that the tabling of Bill 4 has created a distraction here today. I know we had some forewarning of this, but we're not perhaps immediately. But I came to this meeting prepared to rescind this bylaw based on essentially all the feedback that we received today. We have heard consistently that masks are a tool in the toolkit that helps fight against this pandemic. We have not ever heard that it is the panacea that eliminates this pandemic. And, we've heard consistently from Dr. Sikora that it is quite reasonable at this point to move away from a mask requirement. As a standalone tool, I wonder about, honestly, just how valuable a tool it's been. The city of Edmonton has had a mask restriction in one form or another for the better part of 2 years. And we've had 4 waves since the first wave come our way. Now, one might argue that those waves would have been considerably worse if we didn't have masks, and it's tough to prove a negative, so I'm willing to accept that. At the same time, though, with the latest wave, with the Omicron wave, that virus tore through our community, and I don't know that that masks were doing anything particularly good. I can understand that that they might have value in very closely crowded spaces, places like transit, places like the concourse at Rogers Place, for instance, and I'll continue to wear a mask in those environments. I do not see the value in wearing a mask from the front door to the table in a restaurant, and then to spend 90 minutes in a restaurant conversing with the people across from me and the people around me without masks. I just don't see that having a whole lot of value. The overwhelming feedback that we've received today from just about every group, from our third-party partners like the public library, from those that run our recreation centers, from our business communities, from our business improvement areas, from our public through the surveys that have been provided. And I know we've tried to pick and prod to try to find a way to change the results of those surveys, but those surveys reflect the same tick sheets that my staff have been keeping for the last 2 weeks. And that is that the overwhelming majority of people want to see these restrictions taken back. And yeah, it's unfortunate, per Councillor Paquette's remarks, that there's a number of people in our society now that have lost their capacity to protest intelligently, to protest maturely, to conduct themselves in a respectful and considerate way. But that is a factor in what we're facing here. And if we are looking, as I think we are, at a tool that has got diminished value, and we're considering, from a health perspective, leaving that a restriction in place for what are reduced medical benefits in the face of a number of pretty potentially negative consequences, I'm just not sure that those modest health benefits outweigh those negative outcomes. So that was the decision I came to prior to coming to the meeting, and the verbal report from administration clearly supports that decision. Their very clear and strong advice today has been to rescind this bylaw unequivocally. And so I am going to vote to follow that advice. Thank you.
Thank you, Councillor Cartmel. Please vote on the first reading.
We have all the votes.
Display the votes, please. That is carried. Councillor Cartmel.
Thank you, Mayor Sohi. I will move second reading of bylaw 20061.
Thank you. Second by Councillor Rice. Any questions on the second reading? Please vote.
Point of order, is second reading non-debatable?
We have already spoken on this and the item has been closed by Councillor.
On the first reading, are we not allowed to add remarks in the second or third reading?
You can speak to it. It's not
May I
amendable.
speak to it quickly?
Okay, if you have the right to do so, please go ahead.
Thank you. I just wanted to say I just wanted to justify why I voted against it. Bill 4 will take time. Bill 4 may still be amended. We don't know what's going to happen to Bill 4 in the legislature. It's not going to be passed this week. It could be still weeks away from Royal Proclamation. We could be into June by then. And I don't want to keep masks forever. And I think had the Coots Crossing and the whole schmozzle with Kenny's leadership race not happened, we probably wouldn't be here debating this today. So why I don't want to vote to repeal this bylaw is I think we keep it in place a little longer. And while I support Councillor Knack's suggested bylaw, I don't want to repeal this until it's absolutely necessary. And I worry that by repealing it now, we are going to be giving up a number of protections that we may still very well need. So that's my rationale. I just want to hang on a little longer.
Thank you, Councillor Jans. Please vote on the second reading.
We have all the votes.
Display the votes, please. That is carried. Councillor Cartmel.
Mayor Sohi, I'll move consideration of third reading of bylaw 20061.
Second.
Second by Councillor Rice. So this is for the consideration only, please. Consideration for third reading, please vote.
Councillor Wright? We have all the votes.
Display the votes, please. Consideration is granted. Councillor Cartmel.
Thank you, Mayor Sohi. I'll move third and final reading of bylaw 20061.
Second.
Second by Councillor Rice. Please vote on the final reading.
We have all the votes.
Display the votes, please. That is carried. Thank you, everyone. And I understand that Councillor Knack has a subsequent, right?
Yes, Mr. Mayor, and we can get that up on the screen. It's that administration prepare a new temporary face coverings bylaw similar to bylaw 19408 and return to the March 14th, 16th, 2022 City Council meeting with the intention of the new bylaw, if it receives the appropriate readings, being submitted to the Government of Alberta under the provisions under Bill 4.
Second.
So that's
just quickly introducing it, Mr. Mayor. Again, Bill 4 talks about how it is still within our authority to put forward a bylaw like this. So to be very clear, it still is within our jurisdiction to do this. And what will happen is it will get submitted to the Minister of Municipal Affairs Minister, and he will engage the Chief Medical Officer of Health, Dr. Hinshaw, in order to determine if it is a valid bylaw. And so that's why we would put this forward. I've specifically put it as the similar wording of bylaw 19408, the one we just repealed, because I still feel strongly about that, about having it in all indoor places, as noted by many other members of council. So that's it for introductory remarks. I'll close at the appropriate time. Thank you.
Thank you, Councillor Knack. We have 12 minutes till 5:30. Councillor Rutherford.
I just want to speak to it.
Go ahead, speak to it, Councillor Rutherford. Go ahead.
I can go ahead and speak to
Yeah,
it?
yeah.
Okay. So I just want to say I appreciate the effort that Councillor Knack is putting forward, but I will not be supporting this motion. I have also been really clear that we need to be able to give Edmontonians some certainty, and this drags this on and creates more uncertainty that's unnecessary. I think for me it was important, whatever the results of the bylaw, that the decision was made today. I think that we know the outcome, whether we submit this to the province or not. It's very clear in Bill 4 what we can and cannot have, and so this bylaw written the same way as the one we currently rescinded will be rejected. And so I don't see the point in giving that uncertainty to residents, and that, yeah, I don't see the benefit of this motion, and so we'll not be supporting this motion. Thank you.
Thank you, Councillor Rutherford. Councillor Salvador?
Thank you, Mr. Mayor, and thank you to Councillor Knack for bringing this forward. I do have a number of questions, both for the mover and for administration, so apologies. I'm wondering, similar to Councillor Rutherford, I guess if what we're putting forward is very similar to the recently repealed bylaw, there's that chance, and I would probably say high likelihood that it would not be acceptable. And I'm wondering, given the flexibility within Bill 4 as it currently stands to allow for bylaws that apply to transit and to apply to city facilities, I guess would you see value in I'm seeing a blanket approach that's kind of carbon copy versus I feel like we have my reading of Bill 4 says we have authority over transit and city facilities as it stands now. Is that your reading? And I guess I'm just trying to grapple with that.
Yes, it's my reading, and part of why I left it as sort of mimicking the existing bylaw is that when this comes forward to us on March 14th and 16th, if council wants to amend it to only focus on those areas, that is completely valid. What would be challenging is to only do transit and city buildings first and then trying to amend it back. So I think just in terms of an order of operations, I'd rather have the whole suite available. If council next week votes to shorten it, that's fine with me too.
Great. And just to administration then, once this does come forward, if there is a discussion and decision to pursue just the transit and public or city facilities piece, would that even have to go through this process and be submitted to GOA? Or could that not just be passed as a bylaw?
I would say the latter. So if you keep within the four corners of the legislation, if that's passed, legislation still needs to be passed and proclaimed. If you stay within transit and city-owned facilities, that does not need to be submitted to the government of Alberta for approval.
Okay, and as it stands right now, transit still requires masking, but we don't know when the province is going to enter stage or step 3, right?
That's correct, Councillor.
Okay, I'm just trying to judge here. So it's the 8th. This will be in front of us on the 14th. So I think I'm comfortable with that, given Councillor Knack's answer around some potential flexibility there. Okay, thank you very much.
Thank you, Councillor Salvador. Councillor Cartmel?
Thank you, Mayor Sohi. Similar to Councillor Rutherford, I will not support this bylaw, or this motion, simply because it's too broad. I was just quickly skimming again Bill 4, and the subsection 3.6 says this section does not apply to a bylaw or portion of a bylaw that applies only to property owned or leased and operated by a municipality. So it seems to me that this, as crafted today, Bill 4 is fairly narrowly focused and allows us to do things on City of Edmonton property, which would include transit and rec centers and the like. So a more narrowly focused motion might be something to consider, perhaps. And I guess I would think about that if there was something amended or if there was amendments made if this motion were to pass and something came back to council. Frankly, though, I don't know that I'd support it in any form, and I'll explain why. I do not want to engage in a game of ping pong with the provincial government anymore. I think they've made it pretty clear that while they gave us very clear and different instruction 2 years ago, and I was sitting here 2 years ago when we got that instruction, and I wasn't too excited to have received it. but we received it and did the best we could with it. By whatever process, by whatever path, by whatever politics, quite frankly, the right place for these decisions is with the level of government that runs the health system, and that's the provincial government. And I could listen to some arguments about our transit system and keeping patrons safe in our transit system, so I'm equivocating a bit. But I don't want to spend the next several months putting up bylaws, having our administration write bylaws, only to have them turn around and another order in council or act on the legislative floor simply rescinds that same bylaw. I think the spirit of this Bill 4 is that the province will not tolerate municipalities putting in COVID restrictions and is likely to come back at us. And I just don't think it's worth the bun fight. Now, that might sound like we're being intimidated or that we're being pushed into a corner or coerced or you know, that our political parents are being overly parental. And all of those things might be true. But we've got an enormity of work here. I think if we've got a bylaw that applies only to transit, similar to the current provincial restriction that does still currently apply on transit, that once that provincial restriction is removed from transit, any subsequent review of a transit-focused city bylaw is going to therefore be rescinded at the same time. It becomes redundant. It becomes a redundant effort by our administration. It becomes a redundant effort by us. It ends up in many, many more lengthy meetings debating and lamenting what has been put on our table by the provincial government. They've asked for their hot potato back. I suggest we give them their hot potato back and leave it fully with them, for better or worse. Thank you.
Thank you, Councillor Cartmel. And you know, I hate to do this because I was very firm to follow the rules of not extending the order of the day. But this seems like a very unique circumstances that we have today, Madam Clerk. And if I could get a nod from you to extend if we could extend the order of the day, because I'm wary of your staff as well, right? So to just finish this item. Okay? Thank you for that. Thank you for accommodating. We really appreciate that. I know you have families, you have other commitments. I want to get through this today if we can. So appreciate it. So somebody could move that we extend the order of the day to finish this item.
So moved.
Second.
Yeah, which would mean finishing the agenda on today, right? So yeah. So moved by Councillor Tang, second by Councillor Rutherford. Any questions? Please vote.
I'm a yes, Madam Clerk. I've timed out.
Thank you. We have all the votes.
Display the votes, please. That is carried. Thank you, everyone, for your understanding. I will go back to the list. There you go. Councillor Rice. Go ahead.
Thank you, Mr. Chair. I'm not going to support this motion. The similar reasons as Councillor Cartmel and Councillor Rutherford mentioned. I want to emphasize one more time. I do believe our city council needs to stay in our jurisdiction authority. What type of message our city council wants to send to our Edmontonians, send it to the public? What our administration's effort and time needs to spend on? I just want to keep asking this question to encourage my colleagues to focus on and to think about the answer we could receive. In the past 2 years, and so this bylaw and in past 2 years, and today we just passed the bylaw repeal. And if we put into another bylaw, it appears to me, and we go back to the circle, is redundant work. I, as a counselor, as a new counselor, first-time counselor, I would like to see our city to focus on our energy, our effort, our time, to actually improve the quality of life of our Edmontonians, and to support our local business, and to focus on how our economy can grow and recovery to achieve the goal we want to attract 2 million people living in our city. If that is our ultimate goal, and why we cannot just focus on activities for us to get to there. So I'm very passionate about this. So I'm not going to support. I really want to say one more time, let's focus on our city government, what we should do, what we can do, what we want to do, and also what's the best interest and for majority of our Edmontonians. Thank you.
Thank you, Councillor Rice. Councillor Paquette? Councillor Paquette?
Yeah, thank you, Mr. Mayor. I recommend everyone do a healthy reading of the Municipal Government Act. I just want to put this out there. Part 2, bylaws. Division 1, general jurisdiction. A council may pass bylaws for municipal purposes respecting the following matters. A, the first point, the safety, health, and welfare of people and the protection of people and property. It's in our lane. It is a municipal focus. This is literally something that we should be doing. This is part of serving the public. Okay, so I just want to make that super clear. That's in the MGA. And it's the very first thing in part 2 of the bylaws. So, that out of the way. I would like to offer a friendly amendment. I hope it's friendly. An amendment to the motion that administration return with options, including, and that would be the words, options including. I think that's very friendly. And what that does is it allows us to have this information in our back pocket in the event that we actually need to implement it in the future. Let's say there's another wave and we're like, oh my goodness, we should be having a local mask bylaw. Maybe it gets punted back to municipalities. Who knows? We don't know what's going to happen. The Alberta government may say, listen, we need your ideas on mask bylaws. Well, that way we don't have to start something from scratch. We just have it. So if we can include options including, that might do the trick. And that's something I think that we can all support because that's just being proactive and responsible. So maybe we can do it that way, and that way we can avoid all of these debates in the future. We can just have something that's set and ready to go.
So where would you insert that, Councillor Paquette? Where would you insert that word, options?
I would say the administration prepare a new temporary options. Let's say options for temporary face coverings bylaw and scratch.
Okay, so
or we can say including, similar to bylaw 1940, so just minor adjustment, but that actually opens up the meaning and the intent of this motion, so it's not so restrictive, and so it can be used for
I am not,
lots of different purposes.
so Councillor Paquette, I'm not saying that this is a friendly, I'm not getting unanimous support from council members to be just a friendly amendment, right? So, because motion is on the floor, so council owns the motion now, so it's not up to one councillor, it has to be unanimous, and I'm not getting unanimous nods for this.
Yeah? You're not getting unanimous? No. Some people think it's not friendly?
Nope.
Okay, well, can we put it to a vote?
You have the right to do so, right?
Yeah, I would like to, because I think that it's important.
No?
I'm just, options, we would need to get direction if we're supposed to come back with a bylaw, we need to know what should be in the bylaw.
So options is not.
Well, can we not come back, can we not get options?
So
if
you would like to give us those options, we could list those out for clarity.
So you want us to give you those options. Okay, well, this throws a wrinkle in because I think that we actually do need something like this.
You can think about that for Monday, for the council meeting. If passes, then you can look at adding it could give you a few days to think about it. This will come to council if this passes. Okay?
I'm not sure if that's satisfying me, Mr. Mayor. And I'm not trying to be difficult, I'm actually trying to get a way through here without wasting additional time. But, okay, I guess that's where we're at. So I will support this then as is, even though I think that we should be having a better conversation about it. And we will have a better conversation about it because it looks like I'm being forced to bring something forward at a later date, which I will do. I will support this, and I just want to mention that, this is obviously a fraught conversation, and I personally believe that this has become a wedge issue for political gain by some parties. It's become an issue for profit by other parties, when really this should only have ever been a scientific and health conversation. And it is absolutely well within our purview as a municipality, as proven by a simple reading of the Municipal Government Act. Thank you, Mr. Mayor.
Thank you, Councillor Paquette. Councillor Hamilton?
I'll be brief, just because I understand that we're just past time. I respect what Councillor Neck is trying to do, but I can't support this at this time. I think Councillor Rutherford said it really well with respect to providing people with some surety, even if it's not the surety we would prefer, it is nonetheless surety in terms of the direction the city intends to go in. And I'm inclined to agree with Councillor Cartmel that maybe this was unfairly put on the cities to begin with, but the province has now asked for this back, and it's been probably the most challenging 2 years of governing, to be quite honest. It's been exhausting, to say the least. And if we can, as much as I understand the desire and relate and absolutely want to protect Edmontonians, I agree that the authority on provincial on health matters should reside with the order of government that has the authority, the relevant health authority. So I'm afraid I'm not going to be able to support this at this time. And I really hope that, one way or another, this is, this is the end of these types of conversations that we have to have, because it's been, and I wish I could see Mr. Laughlin in the room there and Ms. Owen. This has been tremendously hard on municipalities across Alberta and across Canada. So that's where I stand on it. Thank you.
Thank you, Councillor Hamilton. Before I go to Councillor Knack, anyone else to speak on this? If not, Councillor Hamilton, Councillor Rutherford, can you take a chair?
Absolutely.
Sorry. Councillor Knack wants to go first. Councillor Knack, we'll come to close, but Councillor Tang wants to speak. I'll take the chair.
Okay, sorry.
Councillor Tang, go ahead.
Sorry for just jumping in here last minute. I am going to support it, especially if it is, as intended, as per Councillor Salvador's comments earlier, with a focus around city-owned facilities. I understand the reason why this amendment is so broad has to do with procedures. And, I think living with, if we're going to be living with COVID, I think this would actually line up with the HEPA filter motion that I introduced the last time we were around. And yeah, I think that's going to line up. And so for those reasons, I am going to support it. And if people are going to be coming to our facilities, the City of Edmonton facilities, I'd rather them to be the safest facilities we have in the city.
Thank you, Councillor Tang. Now, Councillor Rutherford, could you take the chair?
So taken.
Yeah, when I heard the intent from Councillor Knack earlier on, I wanted to support that intent, but looking at the actual language of the motion, I don't think I can support this, because this is particularly just saying, just same thing that we have just repealed, and putting something in front of government, provincial government, if this goes through and goes through the council and all that, right? So I think it doesn't achieve the intent. I am open to the idea of having a bylaw that covers our own facilities, cover our own transit. So maybe once our heads a little bit more clear on Bill 4, I may revisit that later on to bring forward something, right? But I don't think I can support this as it is today. So let's I know it's a very, I would say, time-consuming debate, and it does take away from some of the things that Councillor Rice was talking about that we need to focus on, and so I think that's, so I can't support this as it is, but okay, and I'll take the chair back. I'll go to Councillor Knack to close.
Thank you, Mr. Mayor. I appreciate those comments around surety, but why I am putting this forward is because I don't think we've completed our due diligence because we haven't received the information that we need. And so I think it is very important for us to take this one final step. This isn't a back and forth. This is one final step that is now outlined in Bill 4 that I think we should use. If they would like our bills to be submitted to the Minister of Affairs, Minister and the Chief Medical Officer of Health, I think it's valid to do so. But I'll speak more broadly as to why I'm supporting this and why I think we should continue to look at these options. I think back to March 13th, 2020, when we held a special city council meeting. And at that meeting, we had to make the tough decision to cancel meetings for the rest of the month so that city staff could be able to respond to COVID-19. And I think about that, and I was pretty sure that, that might go on for a few months, but I never would have thought it was going to be 2 years that we are still in this pandemic. And of course, as we've heard, we are still in a pandemic, no matter how much people want to suggest otherwise. Over the last few months, we've seen many more people contract COVID than in any other time in the last 2 years. Fortunately, many of those people were vaccinated, and that has meant that even though there have been a large number of people who got COVID, many have been able to recover. And since many did not experience severe outcomes, that has started to shift people's thinking about how we respond to this virus. And that is a reasonable perspective, and it's completely understandable why we might develop a plan that reflects the changing reality, that learning to live with COVID. But as we've heard today, when it comes to the data used to inform the removal of public health measures in Alberta, there's only a handful of people in this province who actually know what that information is, and that hasn't been shared broadly with the people of Alberta. And I think that is a completely irresponsible approach by the provincial government and really a complete dereliction of their duty. And while I could spend the rest of my time talking about their approach, I really want to spend the rest of my time just talking about what I've heard from Edmontonians over the past few weeks. And for some, the ones that have experienced a less severe outcome and wanting to get back to normal and learning to live with COVID as quickly as possible, I think that's a reasonable position for an individual to have based on their personal experiences. But it's important to acknowledge that getting back to normal is never going to happen. The world has changed dramatically over the last 2 years, and our normal from 2 years ago is not going to be the normal going forward. In the last 120 days, there have been 783 deaths out of the 3,972 that in Alberta over the last 2 years. That means 20% of all deaths have occurred in the last 4 months. And during the same period, we had surgeries canceled and delays because of capacity issues in our hospitals. Those who experienced some of the greatest impacts throughout the entire pandemic, I really find are seniors. And we know that. We see that 89.4% of all deaths are of people 60 and older. And I spoke with many seniors over the last 2 years who had important procedures canceled or delayed. That includes exploratory surgeries to determine the type of cancer treatment. That includes hip replacement surgeries that we know, even though not life-threatening, that pain can be debilitating for people who are waiting for that. So for me, and hopefully for everyone else, it shouldn't come as a surprise that over the last 2 weeks, those that expressed the greatest amount of concern about removing face coverings are seniors. And yes, it wasn't unanimous, but the vast majority of seniors I spoke with expressed concerns about the removal of every public health measure. and view the wearing of a mask as a small action that we can take. And I think we need to at least present that to the provincial government. To me, I think about how this whole pandemic, it feels like we have glossed over the impact to seniors. I mean, I think about the beginning of the pandemic and how it was talked about that the average age of someone who died due to COVID was 82. I mean, the fact that that even came up felt like it was trying to downplay the severity of this virus that has torn apart people. Friday is the day of observance to commemorate the people who lost their lives and the significant impacts that we have all felt because of COVID-19. The worldwide death total has just surpassed 6 million people. I realize that wearing a mask alone is not going to prevent every death or severe consequence. And I realize that for some, the mask has negative connotations. They view it as potentially a loss of their freedom. And while I think the events happening in other parts of the world probably put that into perspective, I appreciate that that is still an impact of this public health measure. But I think it's critical that we at least explore every option before making that final decision. And this won't go over and over and over again. This is one last option, going to the province as per their new bill and submitting this for review. And I think we should do that. So I encourage you to support this. Thank you.
Thank you, Councillor Knack. Please vote.
We have all the votes.
Display the votes, please. That is carried. 7-6. Okay. All right. So we have no more items to talk about, and we are ready to adjourn, right, Madam Clerk? Anything else? I don't see any bylaws, private reports, none.
I'm not sure if the speaker's queue is still open, but it's
Speaker's
entirely
queue.
possible somebody else would like to do something.
I don't see any list.
I cannot join the speaker's queue. It's Councillor Salvador.
Oh, you want to join the speaker's queue, Councillor
I
Salvador?
would like to.
Okay. It's
Oh, there we go. Now it's open. Yes, thank you. I'll be brief. I would like to put forward a subsequent as well. And I did pass the wording. I think there's an edited version to the city clerk. And yeah, okay. So I'd just like to move that administration prepare a new bylaw to only include provisions for face coverings on public transit and city facilities due March 14, 16, 2022. So yeah, absolutely supportive of Councillor Knack's subsequent. I think this provides that additional layer that will keep our options open. Apologies, I need a seconder, don't I?
I'll second that.
Great. And just to briefly introduce, I think it does hone in on the two elements that we do have control and authority over at this point, given Bill 4. So I'll stop there. I think it's fairly self-explanatory and it came out through the questions previously, but happy to answer any.
Thank you, Councillor Salvador. Any questions on this?
I move we call the question.
Oh, Councillor Rice is on the list, sorry.
Well, I'll
Oops. Councillor Rice.
Thank you, Ms. Mayor. Just a quick question to Mover. For public transit, and we still have provincial health measures in place, and we don't know when that will be lifted. And so that will provide the protection for the public transit. For city-owned facilities, what I heard very clear from administration and even from frontline worker and who work in the city-owned facilities and then support the mask by law resent. So I'm not sure why we need to put this back again. So I appreciate, and you put this, can you explain a little bit more?
Sure, yeah, happy to explain. So your first question around public transit, you're right that there is overlap right now with provincial measures, but we don't know when stage 3 is going to be reached. I mean, that could be next week. We just don't have that certainty. And I think we heard fairly clearly that folks who are using transit really appreciate having that additional protection given the close quarters. So regardless of whether the province decides to change that measure next week, in 2 weeks, I think having that in place for Edmontonians is an important step. Your question around city facilities, I was actually quite encouraged to hear some of the numbers today. So 90% compliance right now is what we're seeing at city facilities, 90% at EPL, for example. So I think that given we do still have control and autonomy over those spaces, that having that additional protection is important for Edmontonian safety and enjoyment of our facilities. So hopefully that answers your question.
Then actually creates two other follow-up questions.
Sure.
So the first follow-up, and is that previous bylaw Councillor Knack provided and will cover the public transit one? And because if we have that discussion, will happen March 14th, 16th, and then to me that is a repeat work. Is that fair to say that?
So from my perspective, I don't think it's repeating. I think that this does not have to go up to the province for approval. Like I said, this is within our authority as Bill 4 outlines. So there's a distinction there in my mind. So that's a big one.
Yes, I understand it does not need to go to provincial government. And however, the scope of the previous bylaw just passed and will cover and then public transit as well. So I just stopped there and because I do have taken my time to ask other questions and follow-up questions. And by looking at the data and then administration provided today, and is that fair to say, and the people who actually take their time and effort to complete the public survey actually use our city-owned facilities. And if that data clear stated, and the majority of people and then is against mask bylaw in city-owned facilities, do we still just ignore that voice, ignore that message, and we receive it from the public, and then put this back? So I don't know who administration or mover can answer this question.
I'm happy to weigh in, Councillor. We didn't ask a granular question like that. We asked generically about masking in the city of Edmonton, not in City of Edmonton facilities. So we don't have data that is that specific.
Okay, so we don't have that separation data. It's just generic.
Correct.
Okay, thank you. Yeah.
Thank you, Councillor Rice. Councillor Cartmel?
Thank you. I guess to administration, this is a fair chunk of work, and I'm wondering about the differences between different city facilities. So we have transit garages, we have snow clearing service yards, we've got recreation centers, we have Fort Edmonton Park. I don't know if we have libraries or not. That's a question. So is this body of work that's due in 6 days going to slice and dice to all of the different kinds of city facilities we're talking about? Would it be public facing facilities or publicly accessible facilities or?
Well, we would interpret this as public facing facilities because as an employer, we're taking steps that we feel are appropriate for our employees within their facilities. That's our mandate. So we would interpret this as public facing facilities. As it relates, you raise a good question. And it kind of depends probably on some of them specifically to EPL. I'm not sure whether those are considered city facilities or EPL facilities, so it's a body of work we'd have to do. I would say, Councillor Cartmel, that the public transit one from administration is is something that I think at this time that would be something we could support, because it does help from an enforcement perspective, because if the bylaw is repealed, or sorry, the bylaw has been repealed, our peace officers aren't able to enforce the public health order. That's left to police and public health authorities. So there is some merit for us in this. Again, we would interpret this as public-facing city facilities.
So there's, just to be clear, Mr. Lachlan, there's merit in the transit side of the question, at least. Is that?
For sure, for sure.
Yeah, I can get behind the transit piece too. I'm a little worried about the public facilities, and I'm a little bit unsure about the timing for you to examine that. So tell us, World of Science, the buildings at Snow Valley, the insides, not the outsides. Those are all, I'm not sure how you're going to necessarily do all that. So, and would you be able to do that in a way that allows a councillor to vote on some parts of that bylaw and not others? Or should this be split right now for voting purposes?
So maybe just on your point, Councillor, the question does become difficult. For example, EPL is not a city facility. So we would need to, we need to examine the specific wording of the bill to break that down and break down the facilities in terms of application.
If I may, Cartmel?
So Councillor Cartmel, right? I'll stop your time here, but would it be helpful if we say city-run public-facing facilities? Would that be more clear?
Well, just based on what administration is saying, I'm not sure that it would. Either they're going to need a lot more time to create lists and charts of different types of facilities, even publicly accessible ones.
Well, so Councillor Cartmel, I think city-owned and operated facilities certainly makes it easier for us to bring back something for council's consideration. Where we get, some of the ones that you brought up are partnered facilities, and as Ms. Plouffe said, it would be tough for us to be able to understand whether that's on side with early review of Bill 4, which was tabled today.
Yeah, and we're all looking at in between. I suppose publicly accessible, city-owned and operated facilities as a refining amendment might be easier to contemplate. I'm not sure that I would ultimately support that, but makes it easier to support today.
And that was, the intention there. Sort of those city-owned and operated, public-facing facilities.
Okay.
So if there needs to be a refinement of wording there, happy to do that.
Okay, good. Thank you, Councillor Salvador. So, Councillor Cartmel, are you finished? Or are you?
I am. Yes, thank you, Mayor.
Okay, thank you, Councillor Cartmel. So I think that will be friendly. I got nods. Friendly? Yeah, that will be a friendly amendment. Yeah. Okay, all right, see that, I'm going to go to the Councillor Rice. So I would need a second round.
I'll move second round.
Councillor Principe, seconded by?
Second.
Councillor Paquette, right? Please vote. My disappeared again. Here you go. Yes, ma'am. Madam Clerk, so I don't know why it disappeared my vote.
We have all the votes.
Display the votes, please. Okay, that is carried. Councillor Rice.
I just have a very quick question, and then for this motion, is it possible to just vote separately and between public transit and the city-owned facilities?
The motion can be divided into two, right? Madam Clerk?
For voting purpose.
just so I'm really clear, you would like to have part 1B that we come back with a bylaw for just public transit, and the second motion would be a bylaw just to include I'm just going to call it public facilities, and then we would need a third option that would include both of those things. You can't split this because the motion as presented has us come back with one single thing. This goes back to Councillor Paquette's question about options.
Okay.
So we will write as many bylaws as you would like us to, but we might need a wee bit more time than have this all ready for Monday.
Just to be clear, respectfully, I don't think we're in a position to write a bunch of bylaws by Monday.
Okay, so this has to come to a later date. We can change the date to,
So if the desire is to get this for Monday, our advice would be as amended with transit and city-owned and operated facilities. And from there, then we can determine the path forward. But I would strongly advise against writing multiple bylaws.
okay, got it. Councillor Rice, that's okay?
Yeah, so I understand it because I didn't understand it from bylaw perspective. I thought just from motion perspectives
Okay. Thank
for the
you.
party 1, 2.
Okay, thank you, Councillor Rice. Okay, anyone else? I see none. Just hold on. Okay, please vote.
Do you want us to display the updated motion really quickly?
Yes.
Yeah, just give us a minute, thanks.
Just wait for the updated motion to be. Here we go. The motion is on the floor. Please vote.
We have all the votes.
Display the votes, please. That is carried. Okay, I'll go back to the list again to see if no one else is clicking in. 1, 2, 3. Here we go. No one is on the deck.
Good night, bye.
Oops. Come on. We are, thank you everyone. Thank you administration for accommodating the extension of the order of the day. We really, really appreciate that. And also council members for staying longer. We are adjourned.